Hi guys, can you see me and hear me? So this is the final class of this course, and since the last 6 months, um, so yeah, long journey coming to an end. When I started, I did not think, when I started off 6 months back, I never thought this through actually, that this is what's going to happen. By the way, if the camera and I look different, that's because yesterday Zara pulled this wire and the camera stopped working, so it's my laptop camera now which I am on. So yeah, that's what happened. So anyways, I was saying that 6 months back I never thought this through, that this will turn out to be so beautiful, first of all, and I'll get such a big virtual family, as a result of this. I never ever thought it'll be so successful, first of all, and useful, I hope. So thank you so much, all of you guys, and I hope that the result is as beautiful as the journey. And my best wishes to all of you. I'm just don't want to say all of this right now because this is not the end for sure. We are gonna be in touch, but best wishes for all of you guys, and Ashirwad class will also come. But just want to say it out, today, because on this platform, I think this is perhaps the last, perhaps the last time that I am also taking a class. So it's very yeah, emotional for me as well. But koi baat nahi. I think life moves on, and to bigger and better things from here on. Yeah. So all the best to all of you also. And an Academy Wale t-shirt, I don't know, maybe they'll take. I don't know if they want my old t-shirts, they can have it, but I don't think they'll take it. Okay, all right. So then let's start off. So lots to do. All right. Baki sari batein we'll do afterwards. है ना? After the exam, we'll have this nice Zoom session and we'll talk. Okay. All right. So then thank you so much for all the love. That is something I really, really have to thank you all for. It's really, really special to me. And every message that you send me, you might feel that it's, I get a lot of messages, but no, each one of them is very, very precious to me. And thank you so much for that love. Okay. It means a lot, and it inspires me to work harder and to give you better content every time. So thank you so much. Okay, all right, so having said that, let's begin. Zaru ko bhi God, Zaru ko bhi leke aaungi. So yesterday I spilled my glass. So this is who I am as a person. This is what happens even after having a child. Yeah. So so Zaru ko leke aayenge end mein. If mother is like this, what will Zaru do? So yesterday she pulled out the wire of camera, but this is what it is. Okay, all right, let's start then. Micro, lots to do. Okay. चलो माइक्रोफाइलेरिया पे थे ना. दिस इज वेयर वी स्टॉप्ड. सो दिस आई थिंक यू गाइस नो. सो एलबीडब्ल्यू मींस पैड को लग के जाएगा बॉल. सो दैट इज व्हाट इट इज. सो एलबीडब्ल्यू इज शीथ्ड माइक्रोफाइलेरिया. ऑलराइट. सो व्हिच एरिया. सो दीज आर थ्री शीट्स. सो दैट इज हाउ यू विल से कि एलबीडब्ल्यू होगा. अब इसमें देखना है कि एंड पे आर देयर न्यूक्लियाई और नॉट. टेल एंड पे. सो टेल एंड पे व्हेन द न्यूक्लियाई vanishes, so vanishes is which area. Yeah. When it is in a line, when it is going through in a, no, not in a line, when it's going, when there are two nuclei in the tip, that is bi. So this is Bruggia malai. And when you see that it's coming in a line and there are no two nuclei, that is line for loa loa. Okay, so that is our LBW. Then we have the ones which are not sheathed. So there you have to see the tail. All right. So whenever tail is having this bend, as you can see here, when the tail is having this bend, that is your streptocerca. So first is identifying that. Then you have two things where there are no nuclei, zero nuclei. So it could be either Manzanella ozardi or it could be Onchocerca. Okay, which is very unlikely that they'll ask you either of these, but that is how you can identify. And then P is straight. All right. So P is straight and S is this. So you just basically, that is how you figure out. But most of the times it has been one of these three which have been tested. Okay. So this is about microfilaria. Very, very quickly about malaria. What are you seeing here? Whenever you see that there is this ring formation. Yeah, so this is your ring trophozoite, and then you have the schizont form, which is showing you the merozoites. This is not falciparum. This is vivax or ovale. So this is P vivax or P ovale. Okay, so that is about the two forms. Schizont will never be seen in P falciparum. When you see multiple headphones appearance, that is your a coal formation, and when you see this banana shaped gametocyte, this is P falciparum. So both of these are Phi falciparum. All right, then P falciparum. And when you see this band shaped appearance, this is P malaria, the most severe one. Okay, so this is P malaria that you have here. Okay, so this is about identification of malaria species. Going on to virology very, very quickly. So virology, we have first of all the pariah one. Who is pariah? Pariah is parvo, right? So parvo is the smallest one because pariah ko nobody is going to give envelope. So this is non-enveloped. And why pariah? Because it is different. It is single-stranded DNA, right? So it's single-stranded DNA. Nobody will give it envelope, and it's the smallest one. Then when we go to double-stranded DNA, which is the norm, we want to see what is enveloped, right? So HP, which is gonna be envelope. So HP ka laptop, you know, it comes with an envelope. So you have what all? You have herpes virus, and you have pox virus, and then you have hepadna. Yeah, so hepadna is hepatitis B, which replicates through an RNA intermediate. So that is done. In herpes, you have lots of herpes. So you have HSV1, HSV2, which are gonna cause your herpes infections. Then you have varicella zoster virus for chicken pox. So remember, chicken pox is not pox virus. Okay. Then you have EBV, which is HHV4. Then you have CMV, which is HSV5, and then you have human herpes virus 6, 7, and 8, which are gonna be causing different things, right? Like we have seen. So in derma, we had seen HHV 6 and 7. What do they cause? They cause P. rosea. Then we have roseola infantum. So all of these infections are going to come from this. You have Castleman syndrome, you have Kaposi sarcoma, primary effusion lymphoma. So all the chota categories are going to come from here. Okay. So this is about herpes. Then in pox virus, you want to remember you have vaccinia, you have variola, and what is the one which does not have pox in the name? Molluscum contagiosum. Everything big is going to be Molluscum contagiosum. Okay, so it's the largest virus, large names also. Complex symmetry. Everybody else is going to have an icosahedral symmetry. Pox will have a complex symmetry. And this is the only one which replicates in the cytoplasm. All right, so all of the nucleic acid replication of DNA is going to happen of DNA viruses is going to happen in the nucleus, except pox virus, which happens in cytoplasm. Okay, so this is the exception here. Non-enveloped, we remember Andhra Pradesh is non-enveloped. AP, yeah, so you have adenovirus, space shape ka jo virus hota hai, and P for papova virus. Papova virus is gonna include papilloma, which is your HPV virus. We have seen HPV yesterday, and it's gonna include the polyoma virus, which would include JC, BK, and SV40, symbiont vacuolating 40. BK is bad kidney, so it causes graft rejection, and JC is junky cerebrum, it causes progressive multifocal leukoencephalopathy. Okay, so this is about the DNA virus category. So anything else remaining is RNA viruses, right? That is how we can approach. So in RNA viruses, all are single-stranded RNA, except what is the exception here? Yeah, the exception here is going to be Rio virus, right? So Rio virus is the exception here. Everybody has a single copy of genome. Everybody has a single copy of Rio is Rota, right? I think you know it. So Rota is Rio virus. Everybody has single copy except 2 copies, which is there in Retroviridae, right? Unsegmented. Whenever you have a lot of bira, hai na, beer, lot of bira you have, you will become segmented. There'll be multiple segments of you which come out. So bira are your segmented viruses. So kon hai bira mein? B is Bunya viridae, I is influenza, R is Rota, and A is arena virus. Okay, so how many segments in each of them? So some math again. So we have 3 in Bunya viridae, 8 segments in influenza viridae. 8 plus 3 becomes 11. So 11 is Rota. And in an arena, 2 people fight. Boxing arena, 2 people fight, right? My pen is lagging a bit. So that is 2 this thing in arena viridae. Okay, so that is what you want to remember. Now all of the RNA viruses are, last time also, all of the RNA viruses are basically going to replicate in the cytoplasm except 3, which is RIN, right? So rim viruses are gonna replicate in the nucleus. So कौन है? One obviously is retroviridे क्योंकि उसमें DNA intermediate आ जाता है. Second is very important, influenza, and third is measles. This is very important because they've asked you life cycle of both influenza and measles separately, and the trick to identify is they are replicating in the nucleus. Okay, इस तरीके से you will be able to identify that. Okay, I hope this is clear. So this is in a nutshell what you want to remember about the classification. Okay, very quickly let's go through the viral exanthems, very important. So first, this is the first ever midnight express. So first disease is measles, right? So measles, the pathognomic spots are gonna be Koplik spots. Okay, so today is all about nostalgia. Koplik spots, and they are against the molars, and you will have conjunctivitis, you will have fever, you'll have a cephalocaudal rash which is going, and it's gonna spare palms and soles, right? We already know cars, which is gonna involve palms and soles, so this is gonna spare. All right, so this, yeah, so this is measles. That is very important. Most common complication of measles is otitis media, and most common cause of mortality is pneumonia, and delayed complication is SSP, right? We will have periodic sharp wave complexes deteriorating school performance. Warthin-Fingalty giant cells, which are intranuclear plus intracytoplasmic. Okay, so that is measles. Second disease is scarlet fever. All you got to do is you got to distinguish it from Kawasaki's. Yes, so the hallmark is unilateral lymph node will favor Kawasaki's disease. Apart from that, both of them can have rash, both of them can have conjunctivitis, both of them can have edema. Yeah, the other specific feature of scarlet fever, good, is going to be pastia lines, which are flexural lines, and perioral pallor, circumoral pallor. All right, so that is the feature of scarlet fever. S pyogenes is scarlet fever. दोनों में ही strawberry tongue मिल सकता है. Okay, both of them will have strawberry tongue. Okay, so this is scarlet fever. Third disease is rubella. They'll give you pointers like in rubella, they'll give you occipital lymph nodes, they'll give you arthralgia. And what are these spots that you will see? You will see Forsheimer spots. Very nice. You will see Forsheimer spots here. On the other hand, साथ साथ ही बता दो, what are the spots that you see in roseola infantile? In roseola infantile, the palatal spots are going to be Nagayama spots. So just on the basis of image, you might not be able to distinguish, but the clinical picture will help you. All right, so in Forsheimer and rubella, you will have arthralgia and occipital lymph nodes, which will help you. So these are Forsheimer palatal spots. Fourth disease is just for the name, Duke's disease is nothing. Fifth is very, very important, parvovirus B19, that is erythema infectiosum, which is slapped cheek appearance, very, very important image. And apart from that, I think you guys know about parvovirus. Nobody forgets about parvovirus for some reason. So you have papular pruritic Gloven-Stocking, which is so rare, but still everybody remembers. Papular pruritic Gloven-Stocking syndrome. Then it can mimic rheumatoid arthritis, yeah, small vessel arthritis. Then very important is the most common cause of non-immune hydrops, and it can also have pure red cell aplasia because it binds to the P antigen. Yes, so very nice. Roseola infantile, this is a very high fever. Yes, the fever is very high. It can cause febrile seizures also. And as soon as the fever disappears, then you have the rash, right? So fever will go and then the rash develops. That is the hallmark. And this is HHV 6 and 7. Roseola infantile, also called as exanthem subitum. And that is where you have the Nagayama spots. Yeah. All right. So very nice. So you guys remember this. Perfect. So this is crash and burn. So Kawasaki's pe one question is always expected. So you'll have conjunctivitis, which is non-purulent. So bilateral non-exudative conjunctivitis. You will have rash. Then you can have, this is the hallmark, unilateral lymph nodes. You will have strawberry tongue and palmar erythema. So the rest of the features are common to scarlet fever also. Fever more than 5 days. Most common complication is myocarditis. Most specific complication is coronary artery aneurysms. Okay, that will lead to myocardial infarction in a child. One of the only causes from child myocardial infarction. Okay, aspirin and IVIG is the treatment. Yeah. Okay, then we have drift and shift. So whenever such mixing happens, this is called as reassortment. S and R is what you want to remember. S and R. So this is reassortment, and reassortment will lead to antigenic shifts, which are these large volume pandemics which happen suddenly. Yeah, so this is sudden pandemics what will happen slowly, slowly, choto choto mutations. These are point mutations. You want to remember Deepika Padukone, correct? So this is antigenic drift, and this is going to be slow, and this will lead to low volume endemics, which are their local endemics. Okay, very important जेई का सारा चीज है. So you need to know who is who, what is doing what role. So pigs सबसे important है. Pigs are amplifiers. Then humans are the dead end host, जिनको वो spread नहीं करेंगे. Mosquitoes are your vector, whereas water birds are your reservoirs. Okay, so this is what you want to know as far as these roles are concerned. So waterfowls or RD'd birds are your reservoirs. Okay, so Culex, this is vector. Okay, ठीक है. So this is about Japanese encephalitis. What is the strain of Japanese encephalitis, which I told you? The vaccine that we use in our country, it is SA 1414-2. Is it a live vaccine or a killed vaccine? It is live, right? On the other hand, जो Nagayama Beijing है, that is a killed vaccine of Japanese encephalitis. Yellow fever is 17D. Okay. ठीक है. Going on to hepatitis. Hepatitis में Australia antigen or the epidemiological marker is HBsAg. Okay, so HBsAg is the earliest marker to rise. So all of these one-liners about HBsAg, all of these names, that is the first uh, antigen, the first marker to be raised. Okay, so HBsAg hai means there is active disease. Once HBsAg goes, then you will have anti-HBs, which is a marker of immunity. So that is how you're going to identify. If HBsAg is positive, means it has to be infection. When anti-HBs is there, so either you have recovered from disease or you have gotten vaccinated. So this is how your approach has to be. It can be either or. Both of them cannot be present together. Okay. Now, we have a window period in between when HBsAg disappears. Okay, so how do you identify in that window period? That marker is your core antigen. So HBC is very important when you have both of them to be negative. So this tells you that the person is in window period. Okay, so very, very important. E ka kaam hai infectivity. If E antigen is positive, means you have high infectivity. If anti is positive, means you have no infectivity. All right, so let's approach this. So they'll give you this scenario and you have to identify. So when HBsAg is positive and IgM hai, matlab acute. So IgM versus IgG will tell you whether this is acute infection or chronic infection. Remember C stays for life. Core hai na, hamara core hai to hum hai. So core stays for life. HBC will never go away. Okay, understood that? So this will always stay unless when core is not there, matlab कि आपको इन्फेक्शन हुआ ही नहीं है, यू हैव गॉट एन इम्यूनिटी थ्रू अ वैक्सीन. ओके, सो दिस इज द कोर ऑफ द वायरस. इफ वायरस हैज कम इन योर बॉडी, means core has to come. Yeah, pre-core mutant is a rare thing. You can just forget. They've not asked you. Even INICT has not asked for core, so you can just forget about that. Okay, right. So this is vaccine. So now here, what does this tell me? That there is acute hepatitis infection with high infectivity. E antigen is positive, so high infectivity. When this has become G, means you have an infection for a long time. This is chronic hepatitis because HBsAg is also positive, and again it is high infective. Then what you have here is acute infection with low infectivity. Yeah, so acute hepatitis with low infectivity. Then still acute, but now what is happening? You have nothing which is positive. So this means that we are in the window period. So it is an acute infection which is high infective, but we are in the window period. What about this? When this has become chronic and antibody has come, and you have this antibody also, means you have recovered, right? So this is recovered from hepatitis. Okay, so I hope this approach is clear now. Very, very important. Co-infection, super infection. May actually the answer was something else only. Co-infection was basically you were given this picture, acute hepatitis picture, and they gave you HDV also positive, so that becomes co-infection like that. So usko is table say there's nothing that you will be confused with. So that time you have to see whether HDV ka kya hai, like that. Okay, understood? Fine. Okay, so hepatitis B versus hepatitis C. Hepatitis B may the associations are gonna be pan 30%. This has also been tested. So polyarteritis nodosa you want to remember, and apart from that you have MPGN. and MGN, membranoproliferative and membranous, which is also very, very important. Hepatitis C may you remember cryoglobulinemia, you remember lichen planus. All right, so cryoglobulinemia and lycoplanus. एक बार super and co-infection का एक बार group पे somebody can just write, all right, तो वो तब discuss करते हैं. So this is about hepatitis C, and anything else you want to remember? Porphyria cutanea tarda. Correct. So porphyria cutanea tarda is also hepatitis C. Fine. Leucoclastic vasculitis करके भी दे सकते हैं for cryoglobulinemia. Okay. Fine. So this is about hepatitis. Bioterrorism agents. इसमें से what question has come is I think anthrax. So anthrax is category 1. All khatarnak are category 1. Okay. So smallpox, anthrax, botulism, plague, tularemia, viral hemorrhagic fever. So almost everything that we have discussed in the BTR is all category A. Ebola will also be category A. So whatever sounds very dangerous is category A. Category rubella family, rubella has now become matona. है ना? That is what I have told you. It's now become matona, pelidos, toga crew. ठीक है. Category B is brucella, clostridium, salmonella, shigella. So normal GI wale are all category B, and category C are Nipah, Hanta, SARS and corona. I mean SARS corona. Okay, so you can just remember this. Fine. Zika must be C, I think, because it is emerging. ठीक है, जीका मस्ट बी सी, एक बार चेक कर लो. ठीक है, फाइन. गोइंग ऑन टू फोरेंसिक नाउ. ऑलराइट, सो नाउ गोइंग ऑन टू फोरेंसिक नाउ. डोंट आस्क इंडिविजुअल एजेंट्स एंड देयर कैटेगरी, नो, जस्ट सी कि जो आया हुआ है ना, यू कांट मेमोराइज एवरीथिंग. बैलिस्टिक्स जस्ट वांट टू रिमेंबर बीबीटी. ओके, सो बीबीटी में यू वांट टू रिमेंबर फ्लेम इज गोना बी बर्निंग, स्मोक इज गोना बी blackening, tattooing is gonna be unburnt powder. So how to distinguish blackening and tattooing? So tattooing, you want to remember that this cannot be wiped off because this is dermal, whereas epidermal blackening can be wiped off. And then wherever the bullet goes, you'll have a grease collar and an abrasion collar. So we just got to see what is the position and we can see. Okay, so whenever it is cruciate or cherry red, whenever it is cruciate or cherry red, you can see that it is contact, right? So this is a contact shot. These are the two markers of contact, and here you will not see BBT, GCAC because it is all inside the wound. All right, when you see everything, when you are seeing burning, blackening and tattooing and grease collar, abrasion collar, means this is a close range shot. All right, and right now we're talking about rifle. Okay, so this is a close shot. When you don't see BB but you just see T, only when T is seen and BB is not seen, and you are seeing grease collar and abrasion collar, then it is a near or an intermediate injury. There is no difference in rifle, but there is a difference when we talk about shotgun, है ना? And finally, when you just see grease collar, abrasion collar, that becomes a distant shot. All right, when we talk about shotgun, यहाँ तक सब कुछ same है, fine, but in near, intermediate and distant, now shotgun के pellets are gonna be separate. So in the near one, it's gonna have this sort of a rat hole kind of an appearance. Intermediate mein you will see one big one, and then you will start to see dispersion. In distant, no main injury, it's all gonna be dispersed. So this is how shotgun is gonna be different. यहाँ तक सब कुछ same रहेगा. Okay, so this is how shotgun and rifle. All right, I think Komal, I answered your question. Okay, so this, you'll see different pellets in shotgun, whereas there will be only one thing in this thing. Fine. Close is near contact. As a word near contact I have not heard only, but I guess. Okay, then types of bullets. Type of bullet, what are you seeing when एक साथ दो bullet निकल गई? So this is seen in old unused bullets. That is where you will have this piggyback or tandem. All right, so this is piggyback or tandem bullet. When you see that it becomes mushroom like this is the Indian bullet, which is dum-dum bullet, which is your partially jacketed bullet. तो आधी खुल जाएगी, dum-dum हो जाएगी. This completely fragments, so this is frangible. Okay, so this is fragmented or frangible. And when you see that as a खुल गया, means it has ricocheted from somewhere, है ना? तो कहीं से लग के कहीं पे गया. So this is ricochet, and this is the only place where entry and exit wound will be on the same side. Yeah, so entry and exit can be on the same side if it has ricocheted inside the body and it has come out. Okay, yawing and tumbling bullets are two things. So when it is like a yawn, slowly yawn करते करते धीरे धीरे it's going on its own way, that is yawing. But tumbling is ऐसे घूमते घूमते इतना घूम गया that it's gone back to the same direction also. Okay, so that is tumble, which is complete turn. fine. Whereas yawing is yawn karte karte, slowly, slowly. Okay, cool. Then we have fingerprinting. Before fingerprinting, you have rugoscopy. Rugoscopy is the art of identification by a palette, right? So when you do the palatal prints, hard palate ka print, that is called as rugoscopy. Superimposition is a technique when अपन के skull को आप fit करोगे with picture and you will identify. That's called superimposition. When you use fingerprinting, you have these three. So what is this? So this is your entire identification slide. All right. So you have this arch. Then when you see कि ऐसे गोल 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 घूम रहा है, that is loop. And when it's completely vold appearance, this is volts. All right, so these are the three types of fingerprints that you have. Now how do you identify male versus female? Now, how sorry. Now, how do you identify when you have male versus female pelvis or male versus female skull? Okay, there are two kids at my house right now. Like one friend has come and they're both shouting at the top of their skull. All right, so we have male and female pelvis. So everything that you want to remember here, all and like if one cries, the other child cries. So it's like all right, anyways, we'll come back. So all are large and wide in females except, all right, so except OSA, we are at pelvis, so we are going to compare this, so you want to remember. Yeah, crying or due, all are large and wide in females except OSA. So what is OSA? Obturator. For obviously females need to have higher pelvis, larger pelvis, because they want to deliver babies, but there are three exceptions. So you have obturator foramen, you have sacroiliac joint surface, and you have acetabulum. ठीक है, तो obstructive sleep apnea भी तो males में ही होता है ना, तो males में larger OSA होता है, तो that's how you can remember. So obturator foramen, sacroiliac joint surface, acetabulum. Let's see, I hope this is visible to you, है ना, ठीक ठाक ही है. Okay, so what do we see? That in female everything is large, है ना, you can see pelvic inlet, pelvic outlet, pubic arch, subpubic angle, pelvic brim, sciatic notch. You don't even have to see, except three things. What three things? A for acetabulum, S for sacroiliac joint surface, and O for obturator. है ना? तो ये कितना easy हो गया ये पूरा table. So nice. Then you have skull. How do you go about skull? Male versus female skull. तो इसमें क्या करना है? Again, face is larger in males, right? Very logical. So all of the things are going to be larger in males except fronto and parietal eminence, because we have very sharp features as females, right? So frontal, parietal eminence and nasal apertures are going to be larger, and हमारा forehead, orbit and chin round होगा. ठीक है, so easy, you can just see a female and it is easy. So frontal eminence, parietal eminence is large, and orbits are round, forehead is round, and chin is round. Okay, everything else is gonna be large, more pronounced in males. So easy. This इस पे से सवाल आया तो क्या ही है इसमें? Remember OSA and remember the exceptions. Okay, fine. So this is done. Now going on to bone age. This is also something where I have a lot of nostalgia. This is one of the first topic which I taught from different subjects. So you remember Eshaki wrist. Okay, so Eshaki wrist is when the joints become ready. So the earliest joint to fuse is at 16 years, that is elbow. Elbow सबसे पहले ready हो जाता है. Then you have shoulder, hip, ankle, knee, and wrist is the latest at 19 years. Okay, so so this is Eshaki wrist. Let's talk about elbow. Elbow, you want to remember crito, right? What is crito? So crito is capitulum, then radial head. I को confuse नहीं करना. This is inner, meaning medial epicondyle. T is trochlea. O is olecranon. This is not outer. This is olecranon, and E is external or lateral epicondyle. Okay. So how do they appear? Just 2 years, 4 years, 6 years, 8, 10, and 12 years. Okay. So how do they fuse? So you also want to remember when they fuse. So LMNOP, the LMO. So 14 pe lateral side will fuse, 15 pe medial side will fuse, and olecranon will fuse at 16 years. So first of all, what do you see here? That the lateral epicondyle has appeared, right? Sorry, this is the lateral epicondyle. So lateral epicondyle has appeared, but has anything fused? No. LMO, nothing has fused here. So what do I know about the age of this patient? That this female must be more than 12 years, but less than 14 years. So 13 years. So that is how you do bone age estimation. Understood? Then wrist can be asked. So wrist pe yaad rakho. Sabse pehle, can you identify the bones? I'm sure you know. She looks too pretty. Try to catch her. So scaphoid, lunate, triquetrum, and pisiform, trapezium, trapezoid, capitate, hamate. This is the hook of hamate. All right. So she looks too pretty. Try to catch her. So 2 months पे कौन आ रहा है? Who is the largest bone? Capitate. तो capitate will come very early at 2 months. 3 months पे उसका भाई will come, which is hamate. Okay. 3 years पे now what do you have? जिसके नाम में ही try आता है. So you will have triquetrum which comes. All right. And then when triquetrum comes, so lunate is like, अरे मुझे भी ले जाओ. So then lunate comes at 4 years. 5 to 6, these three are under pressure कि चलो साथ में ही चलते. So 5 to 6, STT, तीनों will come, and finally in the end you will have pisiform which appears. In addition, you can also remember that radial head appears at 2 years, ulnar head appears at 6 years. Okay, so this is how you can remember wrist, and ultimately everything fuses by 19 years in the end. उसके अलावा they can ask you xiphoid. So xiphoid में you want to remember these processes, when do they fuse? So 15, 20, 25, middle के 15, 20, 25. After that, this, thank you so much. After this fusion of body with xiphoid happens at 40, and ये वाला manubriosternum तो बहुत end में old patient में होएगा. Okay, so you remember 15, 20, 25, and then 40, and then elderly, like that. Okay, clavicle में just remember medial, and this has been asked in FMG, I think. So this is 18 to 19 years पे it appears, and it fuses by 20 to 22 years. Okay, fuses by 21 years. So 18 and 21 is what you can remember here. So bone age is done in a nutshell. Very, very important. We want to do the antidotes. Believe me, you will get one question from this slide always. Okay, very, very important. Antidote of PCM is very, very easy. N-acetylcysteine. Yeah. So this is extremely important. We have done King's College criteria. Also, methanol and ethylene glycol, दोनों का ही है fomepizole. Ethanol होता है, but ethanol is not a better. Obviously, you don't want to give more alcohol. So fomepizole is a better answer. F से ही याद रखो, flumazenil. Flumazenil is benzodiazepine. TCA has been asked so many times. TCA toxicity, remember, whenever you want to basically, whenever the QRS complex is more than 100, that is the indication of giving sodium bicarb. Okay, sodium bicarb, 3 C's, comma, convulsion and cardiotoxicity. So basically neuro and cardiotoxicity is what happens. Beta blocker, because CMP increases, you want to give glucagon. Okay, very important. Cyanide toxicity, you want to give a triad of 2 things or 3 things basically. So you want to give amyl nitrite, and in addition you also give sodium thiosulfate. Okay, so this is what we give here, which is called as Lily's kit. Very good. So you give amyl nitrate, you can also give sodium thiosulfate. In addition, apart from this, alternatively you can also give hydroxycobalamin. Very good. Okay, so this is about cyanide. Carbon monoxide is 100% hyperbaric oxygen, nothing important. Myth hemoglobin is methylene blue. Yes, so here it is methylene blue, which is the antidote for opioids. So many times this has been asked. Very simple, it is naloxone in acute toxicity. Chronic है तो naltrexone. Okay, digoxin के लिए digifab है, मतलब monoclonal antibody के fragments है, digifab you can give. LA toxicity, so this is last, so this is 20% intralipid. So remember, 20% intralipid is for LA systemic toxicity. Same like TCA, this is also cardio and neurotoxic. तो seizure आएगा या फिर cardiotoxicity, shock में चला जाएगा patient. warfarin के लिए विटामिन K दे दो, ठीक है, so easy. heparin के लिए क्या दोगे? protamine sulfate. For dabigatran, very, very important, it is idarucizumab, है ना? तो remember daru again, so idarucizumab is what you can give. Sorry for this. Okay, idarucizumab. Iron, so easy, desferrioxamine or any of the iron chelators we can give. This has been asked in this time FMG. For lead, what can be given? So EDTA is the best answer. Calcium disodium worsenate is what they can write, or they can write EDTA. Apart from EDTA, you can also give BAL, you can also give DMSA. Remember, both BAL and DMSA are useful in lead, mercury and arsenic, but BAL is contraindicated in, यही बता देगा, it is contraindicated in cadmium and iron. Okay, so they are useful in all of them, but for best in lead poisoning, choose sodium this thing, worsenate or EDTA. Okay, same thing. Copper के लिए what is the antidote? It is potassium ferrocyanide. Penicillamine भी ठीक है, but the best one is potassium ferrocyanide. ठीक है, penicillamine भी acceptable है depending on what options you get. For arsenic, it is a freshly made Fe2O3 है ना. I don't know why I remember this freshly made, but it's hydrated Fe2O3, that is for arsenic. Extremely important. Organophosphates, what is the poisoning? Cholinergic poisoning, right? So you have acetylcholine esterase ka irreversible blockade, so you want to give anticholinergic drugs, you want to give atropine and pralidoxime. But when it is with carbamates, then we don't give oxymes, because that's reversible inhibition. When do you do alkalization of urine? Whenever you have weakly acidic drugs. So this is a very important list है ना. So NSAIDs में सबसे important कौन है? Salicylates. Yeah, so aspirin is a weak acid or salicylic acid. So salicylic acid में, first of all, can somebody tell me what is the acid base imbalance that you will have? Yes, so which is early में ना patient hyperventilate करेगा. So respiratory alkalosis first, and then you will have the acidosis, which is metabolic acidosis because of this. So that is your macra. All right, so that is what you want to remember. I have not included acid base balance because I felt like, that so much more to do. So you can just see the last BTR which I've taken on cerebellum YouTube. No, I will try not to cover any of those topics today, so that you can just see that in addition, and everything is done. Usme bahut kuch covered hai, all cannula and everything. So just see that also in addition. Okay, in the end I'll tell you what all abhi bata deti when I forget. So in addition to these 3 classes, do see the image thon which is there on YouTube, and then you see the cerebellum wala BTR, which is the last BTR. उसमें लिखा है FMG final punch ऐसा कुछ कुछ. So see that. ये दो बस देख लेना. और दो चीजें इंक्लूड नहीं करी जो रिसेंटली आई हैव टेकन, व्हिच इज एंटी माइक्रोबियल्स एंड एंटी कैंसर. सो जस्ट गो थ्रू दैट पीडीएफ. दैट आल्सो आई फील दैट you will be able to do. Okay, everything else I've included. No other BTRs you gotta see. You can just go through now only. Once this class is over, just go through the list of all BTRs. If you feel some topic you don't know, you want to revise, तो वही के वही देख लो. Imagethon is the final MKI which I took, no, for 2 hours day before yesterday. That one. ठीक है. I will take 2 more BTRs just before NEET, but it'll be mostly like all of this content only. अब मैं कहाँ से लाऊं नई चीजें? Okay, so like anything new I will. Monoclonal antibodies is here, no, Ankita, it is there here. So it'll be like a combination of these things only, which I feel is important. ठीक है? ओके. ऑलराइट, सो दिस इज कहाँ से लाओ? 19 सब्जेक्ट हो गए, अब नया बनाना पड़ेगा. NSAID is salicylate. Okay, immunology I have included in this class only. Let's see how much we can do today. उसमें से बचा हुआ will also come to you as homework. ठीक है, चलो तो फटाफट करते हैं ताकि होमवर्क ना मिले. ओके, सो अल्कलाइजेशन में और कौन से ड्रग्स हैं? बार्बिट्यूरेट्स, क्लोरप्रोपामाइड, मेथोट्रेक्सेट एंड सल्फोनामाइड. ऑलराइट, जस्ट गो थ्रू दिस. ठीक है, चलो ये हो गया. नाउ गोइंग ऑन टू आईपीसी सेक्शंस वेरी वेरी क्विकली. सो बताओ दादाजी वाली स्टोरी वेरी वेरी क्विकली. सो 82 इज, दादाजी के 2 बच्चे थे. लेस देन 7 years there is going to be no liability. 7 to 12 years we have to see whether this person is mature or not. 84 is McNaughton's rule, wherein they say that if person is insane or person is intoxicated, they are not liable. Basically insane को कुछ सजा नहीं मिलेगा. First से forced intoxication. So after this sadma means after this trauma, dadaji was made drunk by friends, so forced, and every time you have to be forced once. After that it's always self intoxication. Okay, so this is your 82 to 86 ka list. Then we go into the consent list. So 87 says the consent can be given by anybody who is more than 18 years. Okay, 18 years pe you can give consent. Consent cannot be given less than 12 years. All right, so less than 12 years consent cannot be given. 0 means null and void. So what consent is null and void? Null and void consent is any consent which is given by insane person or intoxicated person or forced consent ले लिया, misconception में हो गया, or given by less than 12 years. Those are all consents which are not valid. 92, nahi do. Nahi do means in emergency, it is an implied consent. You do not need to take consent, it is implied. Okay, so that is 92. This is very important. Consent पे सवाल आए हैं. Then we go into the perjury section. So 191 is lying under the oath, that is perjury. 192 is fabricating false evidence. Okay, so you're not just lying but evidence भी झूठ दे रहा हो. 193 is the punishment for the two above. 197, remember my 7-year-old nephew who asked for false medical certificate, है ना, तो false certificate दे दिया, that is 197. 201, very very important, is destroying evidence. So you are destroying evidence as a doctor. How can you destroy that? Maybe you are, without examining properly, आपने तुरंत ही you are doing embalming, or you were supposed to preserve viscera for poisoning, you did not do that, so you're destroying evidence. You're not destroying, but you are concealing, you are hiding information, that is 202. So subtle difference here. Okay. Right. 228A, very important, is disclosing the identity of a rape victim. Okay, so rape victim ka identity media ko bata diya, very important. This is 228A. Then we're going to murder. So whenever it is murder, but this is basically culpable homicide, it is not amounting to murder, meaning person is dead in both cases, but there was no motive, means you did not go out to kill, mar gaya galti se. So culpable homicide. But when it was intended, that is culpable homicide amounting to murder, that is 300. Okay, yeah, intent. Then 302, what is more serious? This is more serious, right? So 302 is the punishment for this, whereas 304 is punishment for just culpable homicide. Okay, so this is the order of murder. 304A is medical negligence, extremely important. Definition of medical negligence, you need to be on duty, there has to be proof of breach of duty, act must be done, and there has to be damages. Very very important, damage has to be there, means person has to be dead, or there has to be outcome. Just because you were not there on duty and something did not happen, that's not medical negligence. So these are the 4 Ds that need to be fulfilled. 304B, hit and run also, fine, that's not very important to us, no. So 304B is dowry death. Within what time span will we include this? It has to be within 7 years. There has to be proof that dowry tha, torture tha female ka. But when there is no death, but you are just basically torturing the female, the family is torturing, that is 498, torture or harassment basically. Okay. Then we have all criminal abortion. So midnight express I started with consent. So 12, remember, midnight पे पढ़ना है, तो it has to be consent. So consent के साथ criminal abortion किया. But without consent, if you are taking no consent, that is 13. Then if that results in death of female, that is 314. 315 is you tried to do criminal abortion but वो नहीं हो पाया. So now what will you do? You will do infanticide or feticide. Okay, so that is 315. ये भी नहीं कर पाए तो what will you do? You will abandon baby, right? So 30317 is abandoning child. But if you abandon, like neighbors will ask, कहाँ गया आपका baby? So what will you say? You will have to conceal birth. Okay, so 318 is concealing birth. Okay, so this is our criminal abortion ka. One more thing which I want you to see is MTP Act. Okay, that was covered in one of the midnight expresses. मैं भूल गई पढ़ना, वरना मैं ही बता देती. But do see this. इसके numbers are important. Updates are important. Who can do MTP? What are the criteria? Just read that. Okay, side में लिख लो अभी paper में, revise it अभी के अभी. 319 and 320 is hurt and grievous hurt. Grievous hurt is very important. So इसके ये सातों chapters भी पताना चाहिए. So one is emasculation. What is the most important to a man? Masculinity. So वही हटा, emasculation. Then you come to face. What is more important to female? Face. Okay, तो face में क्या start करना है? Eye. So eye, उसके बाद eye के बाद ear, है ना, इसमें ऐसे ऐसे जाना है ना. So one is eye, then you go to ear, then you go to any member or joint, then you go to tooth, है ना, ऐसा करके, and then any endangerment of life which is for 20 days. Okay, 20 days तक you have to be in bodily pain or in hospital. So कैसे कैसे करा? Sight गई, hearing गया, any member or joint of the body is gone, जिसका या तो privation हो गया या destruction हो गया, permanent disfigurement हो गया of head or face, or there is dislocation of bone or tooth. Okay, 14 days was asepsis ना, asepsis के लिए. ठीक है. 326 क्या है? एसिड अटैक. सो एसिड अटैक अगर हो गया, दैट इज 326A. बट व्हेन देयर वाज अटेम्प्टेड एसिड अटैक, दैट इज दिस. ओके, एसिड अटैक के लिए कितना पनिशमेंट है? दिस इज लाइफ पनिशमेंट नाउ. ओके, एंड देन दिस इज 5 years. एट अटेम्प्ट इज 5 years. ओके, सो दिस इज अबाउट एसिड अटैक. गोइंग ऑन टू मोस्ट इंपॉर्टेंट, विच इज सेक्सुअल ऑफेंस. सो रेप. सो रेप का डेफिनेशन इज 375, पनिशमेंट इज 376. In this you have 3 categories: 376, 1, 2 and 3. One is what? One is standard rape. Two is when you have rape which is happening under custody, so custodial rape हो रहा है, या फिर pregnant female का हो रहा है, या under communal violence it is happening. And three, I think, has been asked in a repeat paper, which is less than 16 years child ka, that is three. Then you further have A B C D. So A is vegetative state for life, and for life you have a vegetative state or there is death, so that is A. B is BV meaning during separation if there is rape, that is 376B. C is for custody, so any principal or anybody in authority, this can be tested as a scenario that a principal rapes a child, so what is that? Authority figure, that is C. D is for gang rape, yes, and E is for expert mane repeat, yeah, so repeat crime. 377 is any non-consensual unnatural sexual offense. Okay, so that is 377. Remember, that has to be non-consensual. Okay, CRPCs which are important. So 53 CRPC is for the examination. 53 and 53A is for the examination of rape accused. Okay, do I need consent of rape accused? Obviously, is not gonna give consent, right? So no consent is 53, and 53A is gonna be protocol of the rape accused thing. Who can do the rape accused? So the minimum rank which is needed for any police inquest is a sub inspector for sexual offense, and for others it is head constable, है ना? तो ये दोनों याद रखना, सब इंस्पेक्टर इस चीज के लिए एंड हेड कांस्टेबल बाकी पुलिस इंक्वेस्ट के लिए. Whereas judicial magistrate का inquest कब चाहिए? That is for custodial death. So for any custodial death you would need a judicial magistrate to be present for examination. Okay, what is 164A? 164A is the examination of the rape victim, right? Rape victim examination protocol is the CRPC's criminal penal code, right? So it's the procedure and all. 174, 176 is your police inquest and magistrate inquest. ठीक है, या ऑब्वियसली रेप विक्टिम का तो कंसेंट हमें चाहिए. सो नाउ अगेन वेरी वेरी इंपॉर्टेंट, बिकॉज वी आर टॉकिंग अबाउट दैट, this is extremely important because you need to know. So what are the duties of a doctor? So first you need to inform police anytime somebody with a sexual assault case comes, inform police. Second, consent is needed. So what is the consent for examination? That you will be, it will be valid, as we have already seen, more than 12 years you can take consent. If female says no, I don't want to be examined, you have to do counseling before you document. You have to counsel. Still refusal, then you document it and you provide diagnosis and treatment. So these are all of your duties as a doctor, very very important. One you would miss is psychological counseling, so you got to do counseling yourself and then document if there is still refusal. Till what time can I take a vaginal swab? It can be taken for up to 96 hours. Lugol's iodine sample हम कर सकते हैं, है ना, vaginal swab के लिए. And semen sample can be done up to 72 hours because वो motility रहता है. ओके, सो दिस इज वेरी इंपॉर्टेंट. इंडियन एविडेंस एक्ट 3 है. सो 32 इज डाइंग डिक्लेरेशन. 32 के एज पे कोई मर जाएगा तो डिक्लेयर करना वुड बी टफ, ऐसा करके याद रखो, डाइंग डिक्लेरेशन. 45 तक वी ऑल बिकम एक्सपर्ट्स इन आवर फील्ड, सो दिस इज एक्सपर्ट विटनेस. एंड इफ समबडी लिव्स फॉर 154 years they would become so hostile, right? So they would be like, मुझे जीना ही नहीं. That's hostile witness. Okay, मुझे जीना ही नहीं means I don't want to live. Okay, so these are the 3 Indian evidence acts. Okay, fine. Then all the declarations that we have, ये तो easy आता ही है. So these are all your declarations for torture, है ना? So imagine we had to do 3 declarations just to say that torture is bad. Hong Kong is where elder people go for gambling and then they are abused, so that is elderly abuse. Venice is a place where you would want to die, है ना? So this is for terminal illness, है ना? तो terminal illness लेके Venice जाएंगे. Oslo and Helsinki from Money Heist, you remember they go together. So Oslo is for abortion and Helsinki is for H for human experimentation. So vowels, vowels, and then H for H. Ottawa, when child touches tawa, you'll be, oh, tawa touch kara. Okay, so that is for child abuse. Okay, this was so nice. And Sydney, again, this is somewhere where you want to go if you have brain death. So Sydney is very beautiful. Geneva, What is Geneva? This is the Hippocratic Oath, and Malta is food strike pay. What is the role of doctor? So malt, है ना? So that is food strike. Okay, so this is about this. Going on to derma mein, because we've done most of the images in MKI, so I just have leprosy very very quickly for you. So possibacillary, multibacillary, how many skin lesions? 0 to 5 or more than 5. Nerves 0 to 1 or more than 1. Any skin slit which is positive becomes multibacillary. So duration here is 6 months and duration here is 12 months. This should be completed within 9 months. This should be completed within 18 months. Okay. Now according to WHO, it is यूनिफॉर्म नाउ, बट अब हमारा एनएलईपी में अभी तक अपडेट नहीं हुआ, बट आई मीन I don't think you will get a question, but if you do get a question, you can follow uniform MDT. Okay, color एक बार देख लेना यार, color फटाफट. Stains I have not included because they're not very important. The only thing which I saw a question was Barberio test. So you want to remember Barberio is for spermin. Okay, if you can just remember this, I think you are good to go. No need to remember the entire list. ठीक है. बाकी टीकमैन एंड टाकायामा होता है, you can just see they are also for this thing, they are also for seminal things. Okay, fine. So in the uniform MDT you have rifampicin, dapsone and clofazimine. So it's just the duration which varies, the drug dosage remains the same. So what is the dose of rifampicin that we give once a month, supervised? Sorry, yeah, Tikman and Takayama are for blood. Yes, not for sperm, they're for blood. Whereas Barberio is for sperm. Okay, yeah, it is 600 mg once a month, supervised. Dapsone is how much? How much Dapsone do you give OD? It is 100 mg. So clofazimine is half of both. So you give 300 mg once a month, supervised, and 50 mg OD daily. Okay, so this is how you can remember. One of the side effects of clofazimine is also ichthyosis. Okay, ichthyosis is a side effect, and you can also have hyperpigmentation, which can happen. Leprosy, what is the route of infection? It is via droplets. The main important virulence factor or inhalational, the main important virulence factor is phenol glycolic acid 1, PGL1. Most common nerve to be involved in leprosy is ulnar nerve. Yes, ulnar nerve. Remember, post-op also, the most common nerve to be injured in anesthesia, abhi dikhaungi, it is also ulnar nerve. Most common cranial nerve to be involved is seventh cranial nerve. Cause of blindness is exposure keratitis. Seventh nerve aegi, exposure keratitis. Most common nerve for biopsy. Okay, you also said TOF ka nerve. TOF ka bhi most common nerve is ulnar nerve only. Okay. Most common nerve for biopsy is the radial cutaneous nerve followed by sural. है ना, तो sural option में नहीं है तो radial cutaneous. Okay, and earliest sensation lost is temperature, जिसमें भी cold sensation goes first. Okay, so these are the one liners of leprosy. Lepra reaction is very important. Sum total should be 5. So type 1 is a type 4 reaction and type 2 is a type 3 immune complex reaction. This is seen whenever you have borderline BB, BT, BL, whereas type 2 is in lepromatous pole, right? This is seen in lepromatous pole. This is in relation to treatment. This has no relation. So this is seen within 1 year of treatment because the immune status changes. The clinical feature is going to be pre-existing lesions become red. All right. So there's going to be increased redness and abscesses in existing lesions. Whereas here you have new lesions which develop, nodular lesions which develop with systemic involvement like fever, arthralgia, orchitis. Drug of choice for this is going to be, drug of choice for both is going to be steroids, but here the first line that you give in type 1 is NSAIDs. NSAIDs is first line. Here if they ask you most effective, it is thalidomide, but it is not given. First line here is steroids. I hope this is clear. Okay, steroids are best for both, but you read most effective and you read first line. Okay. Okay, going ahead into ENT now. All right, so yeah, continue MDT. Do not stop MDT. 150 questions from all these BTRs. Let's hope so. That's the hope. But then we have to. It's not never gonna be direct questions. It's always gonna be indirect. You have to analyze. Okay, so questions will be for sure from these topics. Now the ball is in your court. In those 3 hours, how well you are able to apply and guess the answer, because now you have the knowledge. Now you just have to be smart. All right, so अब आपको यही करना है, confidence लेके जाओ. Be smart in those 3 hours. Be confident. That is the most important. Okay, right. So what is this sign? This could be battle sign if history of trauma, but if they tell you there is ear discharge, discharge which is there. So this is the Greisinger sign. Okay, so this is the Greisinger sign, which is a sign of lateral sinus thrombosis, which is a complication of CSOM. Okay, so what is the Samter's triad? Very very important. क्या देखना है Arvind? What do you want to look? Samter's triad is going to be aspirin hypersensitivity. There are nasal polyps, which are the ethmoidal polyps, and what is the third thing? तीसरा triad क्या है इसमें? Nasal polyp, asthma. Yes, so asthma, nasal polyps, and aspirin hypersensitivity. Trotter's triad is for NPCA, nasopharyngeal CA. तो उसी में से बन जाएगा. What are the three things? One, there is neuralgia. What neuralgia? You have trigeminal neuralgia. P is palatal palsy, which is 10th cranial nerve palsy, and C is conductive hearing loss because of blue ear. This I already told in MKI. ठीक है, एंड में पूछो ना लिंक्स वगैरह के एंड में. So NPCA. Gradinego syndrome is for petrositis. Again, a complication of CSOM, wherein what do you have? You have sixth cranial nerve, so you will have diplopia. You have fifth cranial nerve, so you will have retroorbital pain. And what is the third thing that you have here? Retro and ear discharge, because it is because of CSOM. Okay, so ear discharge, retroorbital pain, and diplopia. ग्रिसल सिंड्रोम इज एटलांटो एक्सिल अभी सब इस पे ध्यान दो. नो एंजाइटी इन द मिडल बिकॉज यू आर लूजिंग आउट, है ना. तो अभी जस्ट पढ़ाई. एटलांटो एक्सिल डिसलोकेशन विच हैपेंस बिकॉज ऑफ द रोज पोजिशन इन टॉन्सिलेक्टमी एंड एडेनोइडेक्टमी. Guerin sign is seen in Leafort 1, wherein you have the greater palatine artery which is bleeding. Okay, so these are your G's and your confusers in ENT. Very important. It is easy, but just because so many questions come, they'll always tell you which is the one artery which is not a part of the Little's area. So posterior ethmoidal is not a part of Little's area. The other question they'll give you that हमने सब artery को block कर दिया. I embolized external carotid artery and still bleeding is happening. So which is the artery which is bleeding? Then it is anterior ethmoidal, all right, which is it is a branch of IC. Okay, so these are the two questions which always come. And then what is the artery of epistaxis? It is sphenopalatine. That is why if Trotter's maneuver, which is you bend forward and you pinch, if that is not successful, then what do you go for? Then you have to go for endoscopic ligation of sphenopalatine artery. All right, so that is ELSA that you first try. अगर इससे नहीं हुआ तो maxillary block कर दो, इससे नहीं हुआ तो external carotid, which is not never done maxillary. Okay, यहाँ तक ही करते हैं. So this is what is very very important. CA larynx staging you want to remember. T1 is vocal cords have to be mobile and any one subsite is involved. All right. So any one subsite, glottis, supraglottis or subglottis, mobile. Next में क्या हो गया? Vocal cord limitation हुआ है, but they are not fixed. Third में क्या हो जाएगा? Vocal cord fixed हो जाएंगे. So here you have two subsites which are involved. In T3 you have three P's. What three P's are involved here? Preglottic space, paraglottic space, and postcricoid space. Okay. So that is about 3 P's. And then inner cortex of thyroid. All right. Inner cortex of thyroid is T4. Anything else is T4A. So this was the question which came if both the thyroid cortices are invaded, that becomes T4A. T4B is important. So what is important? ICA, mediastinum or perivertebral space. If the tumor goes very down into mediastinum, पीछे prevertebral, ICA, it's T4B. So this is CA larynx. End staging ipsilateral less than 3 is N1. 3 to 6 ipsilateral single is N2A. Multiple less than 6 is N2B. Bilateral, so very very important. N2C is contralateral. Unlike axillary, this is not metastasis. This is N2C. And anything more than 6 is N3. 3 twos are 6. Okay, so this is how you want to remember. Neck dissection is done. So we have three types of neck dissection. Radical with everything removed. So you remove submandibular gland, parotid, SAN, which is your spinal accessory, IJV, and muscle. In radical, modified radical type 1, SAN is the only thing. Sorry, SAN is spared. In type 2, SAN and IJV is spared, and in type 3, all three are spared. So this is also called as a functional dissection. The lymph nodes which are removed is group 1 to group 5. If group 6 is removed, that is called as central dissection. Okay, and this incision is Schobinger's incision. Fine, so this takes care of neck dissection. very important spaces, इसको confuse नहीं करना. So outside the pharynx only you have the buccopharyngeal fascia. Buccopharyngeal fascia है, and then you have the prevertebral fascia. In between you have one more layer which is the Ahler's fascia. So this space here is called, this yellow space here is called what? This is called as retropharyngeal space. This is retropharyngeal. Between alar and prevertebral, what you have is the danger space, and outside the prevertebral fascia is the prevertebral space. So prevertebral space, RP, and danger space. So red is danger. Retropharyngeal space extends up to the tracheal bifurcation, up to the mediastinum. D for danger space extends up to diaphragm, whereas prevertebral space is gonna extend all below till the psoas insertion, iliopsoas tak jayega. Okay, so this is what you have. If you want me to repeat, you will see ENT ka rapid revision very quickly so that you understand in detail. Okay, so this is what you have as far as ENT spaces are concerned. Orthopedics, just the nerve test, because this is very important from anat point of view. Also, your entire upper limb, you know, gets sorted if you know this. So we are talking about ulnar nerve. So ulnar nerve is going to supply all of the hypothenar muscles, except which thenar muscle? Adductor pollicis. Very very important. So adductor pollicis, hypothenar. What about the interossei? All interossei are supplied by ulnar nerve, right? So all interossei are supplied by ulnar nerve. When I talk about interossei, can you tell me what? So we have pad and we have dab, right? So you have palmar interossei and you have dorsal interossei. All palmar interossei are unipennate, whereas all dorsal interossei are bipennate. Okay, so that is what you want to remember. Okay, so all interossei are by ulnar nerve. On the other hand, when we talk about the lumbricals, the first and second lumbricals, which is your lateral lumbricals, are supplied by median, and third and fourth are supplied by the ulnar nerve. First and second, again starting here, so unipennate, and this is bipennate. Okay, so this is how you want to remember the intrinsic muscles of the hand. Okay, so ulnar nerve ka supply ho gaya, interossei, and then you have the third and fourth lumbrical. So here you can have a medial claw hand. Okay, so that is separate, उसको हटा देते हैं. Then how do you test? So interossei, when you are doing a card test, palmar interossei का function कर रहे हो, adduct कर रहे हो, so this is called as the card test. When you are trying to abduct and you are resisting, this is called as Igawa test. Yeah, so this is the Igawa test, which is testing the function of dorsal interossei. You ask them to hold a book. Normally I need adduction, but these guys can't adduct, so they will flex because flexor is intact. So this is the book test or the Froment sign. They will not be able to adduct, so flex करके पकड़ेंगे. Then the digiti minimi is roaming around क्योंकि digiti minimi काम नहीं कर रही. So this is Wattenberg sign. Okay, so this is about ulnar nerve. Median now becomes very easy. So all the thenar except adductor are gone. So you will have atrophy here and you have an adducted thumb like an ape hand deformity. When you ask them to open, basically flex, not flex or extend, they can't flex these fingers, because their FDP is gone, right? FDP, FDS सब कुछ ही चला गया है. So this is pointing index or Oshner clasp deformity or Benedict's Pope hand. Yeah, Benediction Pope hand. Then when you're asking them to touch the pen, they can't do any opposition or abduction here. So this is the pen test. So all of the P's come in median: ape, pointing, clasp, पोप एंड पेन, राइट? सो पी से मीडियन नर्व को आइडेंटिफाई कर लेंगे. एंड मीडियन का ही ब्रांच होता है एंटीरियर इंटरऑशियस नर्व, जो कि एफडीपी को सप्लाई करते हैं ऑफ द इंडेक्स फिंगर. सो हियर दिस फ्लेक्शन विल नॉट हैपन, सो दे कांट मेक दिस ओके बिकॉज दिस फ्लेक्शन इज नॉट हैपनिंग. ओके, सो ओके साइन, दिस इज ऑल्सो कॉल्ड एज किलोनेविन. You are getting one question for sure from these two. Okay, so this is integrated anat question which comes अनैट ऑर्थो सब में आता है. सो ये गलत नहीं करना. List of nerve injuries: shoulder dislocation, neck of humerus, it is the axillary nerve. What does axillary nerve supply? Axillary nerve supplies the deltoid and it supplies the teres minor, right? So there will be no external rotation क्योंकि teres minor नहीं है, and because deltoid नहीं है तो क्या नहीं हो पाएगा, abduction नहीं हो पाएगा. So abduction which degree नहीं हो पाएगा, 15 to 90 mid degree abduction. 0 to 15 is supraspinatus muscle, right? So axillary, and then you will have a Reginald Batch sign. Okay, so that is gone. होल्स्टीन ल्यूइस इज योर रेडियल नर्व, ट्रांजिएंट पाल्सी होता है, अपने आप ठीक हो जाता है. मोन्टीजिया इज pin posterior interosseous nerve, you will have a finger drop. Supracondylar is in this order, amru, so you have anterior interosseous, median, radial, ulnar. I forgot to include miss and lutz, you know this, right? malunion कौन कौन करेगा, very important, intertrochanteric, supracondylar and colis and clavicle. And flutes kya hai, flutes is your non union, so you have femur neck, you have lateral condyle humerus, ulna ka lower one third, tibia ka lower one third, talus and scaphoid, these are all non union. Okay, very very important. ठीक है. No, m is not what, एम में मैंने क्या बोला, माल यूनियन है ना, माल यूनियन. ठीक है. It is not Montegia. One of you said Montegia. No, it's not Montegia. It is malunion. Okay. So this is supracondylar. Elbow dislocation is ulnar. Ulnar nerve injure होएगी. Wrist dislocation is median nerve. Hip dislocation is sciatic. Right? No. Sciatic depending on which dislocation, but most common is posterior. So posterior sciatic, anterior is femoral. Carpal tunnel syndrome, pronator syndrome. What is compressed median? So you want to remember prime minister, PM. All right, वरना ये भूल जाओगे. Pronator is median. ठीक है. Cubital and Guyans जिसमें भी U आ जाता है, answer is ulnar nerve. Supinator इसी से confuse करोगे, so this is radial. All right, so you want to remember senior prime minister, SRPM. Chiralgia or Wartenberg syndrome is your lateral cutaneous nerve of thigh. No, this is superficial radial, है ना, superficial radial. So chiralgia is cheek, so heart, superficial radial, whereas meralgia is lateral cutaneous nerve of thigh. This nerve was also injured, the most common one to be injured in laparoscopic hernia repair, right? Thoracic outlet is T8, C8 and T1, right? So this is C8, T1 roots, and you have nerve more common than vein, more common than artery to be obstructed here. And you remember the raw test. So ऐसा करके अगर दिया, so that is raw, that is Roos, which is elevated arm stress test. अगर ऐसा adduct करके कोई कर रहा है, तो that is Addison. And then when somebody has raised hand, that is right. Okay, so that is your Roos, Addison, and right test for thoracic outlet. In piriformis, what you have? Piriformis syndrome. This is gonna be piriformis में क्या है? Sciatic. हाँ, sciatic nerve ही है. Tarsal tunnel is posterior tibial nerve, and quadrangular space is your axillary nerve again with posterior circumflex humeral artery. ठीक है. So this is about nerve injuries. कुछ मेरे दिमाग में आया था. One of you was asking about musculocutaneous, वो भी बताती हूँ, brachial plexus में बता दूंगी फटाफट. Okay. All right. Now going on to psychiatry. So psyche में timeline ही करनी है, फटाफट फटाफट बता दो. Psyche में time waste नहीं करना. We don't have time. So psychotic disorder, schizophrenia is gonna be more than 6 months, right? If it is less than 6 months, 1 to 6, that is schizophrenia form, and brief psychotic is less than 1 month. Delusion is in only one category. Apart from that, patient is all right. So that is your 1 month delusional disorder. Most common delusion is the delusion of persecution. कि पूरी दुनिया is behind me only. So that is persecution. Folly edu is a shared delusion where one person, if you remove the culprit, तो वो दूसरा भी ठीक हो जाएगा. So that is shared delusion. Capgras and frigoli. So this is, you come home and you're like, oh crap, my husband has been replaced by a stranger. So this is family has been replaced by stranger. So you go, oh crap, okay. Whereas frigoli is all family, where you feel that strangers are my family only. All Indians are my brother and sister. That is frigoli. Okay. Then declarembot is declarembot is a syndrome of erotomania बोलते हैं, right? That some Salman Khan, Shah Rukh Khan loves me, है ना? वो तो मैं ही भाव नहीं दे रही. Erotomania. Othello syndrome क्या है? Othello syndrome is jealousy, morbid jealousy. Okay, so that is Othello. Cotard syndrome is nihilism, right? So nihilistic, my intestines are rotting, ऐसा होना nihilism. Ganser syndrome इट्स नॉट अ डिल्यूजन, बट क्योंकि सिंड्रोम है तो साथ में लिख दिया बिकॉज कंफ्यूजन हो जाएगा. दिस इज सूडो स्टुपिडिटी. सो दिस एक्चुअली कम्स अंडर डिसोसिएशन डिसऑर्डर वेर इन द prisoner doesn't know. So this is seen in prisoners, and they will, do Vorberidon. Ha, Vorberidon is the phenomenon of approximate answers. Approximate answer meaning आप उनको पूछोगे स्काई का कलर क्या है, they will say pink. Okay, like that means they know that color है but झूठ बोलेंगे, झूठ मूठ का. But they're not doing it on purpose. It is a this thing, dissociative disorder. Okay, so this is Ganser syndrome. So this is about psychotic. Then mood disorder, major depression is 2 weeks, whereas mania is 1 week and hypomania is 4 days. अगर पूरे symptoms match नहीं हो रहे, functional decline is not there, dysthymia, cyclothymia is 2 years. Anxiety disorder, remember first of all OCD is neurosis में बात कर रही हूँ, neurosis is 2 weeks. I mean OCD is 2 weeks. Then पैनिक, टू को मल्टीप्लाई कर दो, 4 weeks. सो पैनिक डिसऑर्डर वर्सेस पैनिक अटैक. पैनिक अटैक, हाउ विल यू डायग्नोज? यू हैव दिस फीलिंग ऑफ impending doom. Remember, when they give you case scenario of panic attack, always first thing is rule out organic pathology. In any psychiatric disorder, rule out in organic pathology, do an ECG and confirm, है ना? Very good. So that is panic attack. Panic disorder is having the fear of next attack, right? So that is panic disorder. Okay, so that is 4 weeks tak ye rehna. Then 6 months is phobia and GAD. GAD is free floating anxiety about everything with musculocutaneous manifestations, and phobia is irrational fear of anything. That is for 6 months. Then whenever you have any stressor, if it is a life and death stressor, right? Life and death stressor hai like sexual violence, accident where you almost died, less than 1 month tak flashback आना, and avoidance लेना, that is all acute stress. But when it happens for more than 1 month, that is post traumatic stress disorder. When it is not a life death stressor like a divorce or a breakup and less than 6 months, it resolves. The only criteria which is less, it resolves by 6 months, that is adjustment disorder. Okay, so that is your anxiety. चाइल्डहुड में 1 मंथ पे 2 ऐसे सिलेक्टिव म्यूटिज्म जैसे राज ऑफ बिग बैंग, सेपरेशन एंजाइटी, दैट इज 1 मंथ. 6 months इज ओएसए, वन मोर ओएसए हियर, मेल पेल्विस में ओएसए देखा, दिस इज चिल्ड्रन का ओएसए. सो अपोजिशनल डिफायंट वेर अथॉरिटी से नहीं देख सकते, स्पेसिफिक लर्निंग एंड एडीएचडी. एडीएचडी यू रिमेंबर 2 into 6 = 12. So 6 months तक in two settings in a child who is less than 12 years, we need the criteria of attention deficit. In attention deficit disorder, we'll do behavioral therapy and we can give methylphenidate if the child is more than 6 years. बाकी stimulants नहीं देने. ठीक है. फिर टिक डिसऑर्डर और डिसरप्टिव मूड डिस्ट्रेक्शन, एंग्री बच्चा है ना, दैट इज 1 year तक गुस्से में है. नार्कोलेप्सी मोर देन 3 months, कहीं पे भी आप सो जाओगे. ओके, सो दैट इज नार्कोलेप्सी. फाइन, सो दिस इज व्हाट यू have. Drug intoxication, substance abuse, so hallucinogens with violence and nystagmus, this is phencyclidine or angel dust. Okay, so this is angel dust. Then whenever you have visual hallucinations, bad trip, flashback, this is LSD. Yeah, so LSD comes as a blotting paper, this is acid. So visual hallucinations, flashback. Very, very important. The stimulant which causes chest pain, mydriasis, can lead to shock. This is cocaine. Yeah, so cocaine can cause magnon bugs. This we have already done. You can have bruxism, which is teeth ka ye, and black discoloration. You can have septal perforation because you will snort that cocaine. Cocaine is also called as coke, white lady, snow blue. है ना? So this is all cocaine. Then the other stimulant that you have is amphetamine. So amphetamine or MDMA. MDMA is ecstasy, amphetamine is crystal meth or ice. यहाँ पे violence मिलेगा, choreiform movements, tooth decay and paranoid hallucinatory symptom. Okay. Psychoactive, ये तो पता ही है सबको, this is cannabis or weed or क्या बोलते हैं और, so you can also be called as hashish, marijuana, right? So these are all the other names of cocaine, of cannabis. And here you have amotivational syndrome, रन अमॉक, कंजंक्टाइवल रेडनेस हो जाएगा, स्लोइंग ऑफ टाइम हो जाएगा, स्मेल ऑफ बर्न ड्रॉप। रन अमॉक में क्या करोगे, यू विल किल समबडी देन यू विल किल सेल्फ, है ना, होमिसाइड फॉलोड बाय सुसाइड। ओके, इसमें क्या है, व्हाट इज द एक्टिव कंपोनेंट, इट इज टीएचसी, राइट, सो टेट्रा हाइड्रो कैनाबिनॉइड। इसमें से कहाँ कहाँ से बनता है, सो भांग इज मेड अप ऑफ लीव्स, ड्राइड लीव्स, मजून इज अ स्वीट विच इज मेड अप ऑफ द लीव्स, गांजा, सो रिमेंबर गंजा, गंजा कहाँ से होता है, टॉप से, है ना, सो रिमेंबर फ्लावर टॉप, ओके, एंड किसका फ्लावर टॉप, फीमेल का फ्लावर टॉप। चरस एंड हशीश, चरस इज द मोस्ट पोटेंट एंड बोथ ऑफ दीज कम फ्रॉम द रेजिन ऑफ द स्टेम, है ना, रेजिन ऑफ द स्टेम में से ये बनता है। लास्टली वी हैव opioids, so the natural opioids is opium, but you can have heroin here which is the synthetic form, so यहाँ पे सारे हनी सिंह वाले गाने आएंगे, है ना, so you have dope, you have smack, है ना, ये सारा चीजें यहाँ पे आएगा। हियर यस, दिस टेक्निक इज कॉल्ड चेसिंग द ड्रैगन। यहाँ पे फिर ओपियोइड में क्या हो जाएगा, इट्स अ डिप्रेसेंट, सो यू विल हैव मियोसिस। तो ये याद रखना है, प्यूपिल तो बड़ा ही सिंपल है, स्टिमुलेंट में मिड्रियासिस मिल जाएगा और ओपियोइड में मियोसिस मिलेगा, दैट्स द ओनली थिंग। और जब मियोसिस का विड्रॉल हो जाएगा यू विल बी कोल्ड टर्की एंड दैट टाइम यू विल हैव मिड्रियासिस। ओके, तो लैक्रिमेशन, डायरिया, सब फ्लूइड्स इंक्रीज हो जाएंगे और मिड्रियासिस हो जाएगा, दैट इज कोल्ड टर्की। मार्कीज टेस्ट इज डन फॉर this. Okay, तो ये हो गया substance abuse. Alcohol very important. What are the benzodiazepines safe in liver failure? So you remember lot. So you have lorazepam जो हर एग्जाम में पूछते हैं, oxazepam या फिर timazepam. All right, so lot is safe in renal failure. Withdrawal में earliest manifestation of alcohol withdrawal around 6 hours is tremors, fine tremors. But when you have hallucinations with intact orientation, that is the next sign, which is 12 hours. Okay, so this is alcoholic hallucinosis. 24 to 48 hours you will have seizures, and then 48 hours पे hallucinations भी मिलेंगे with delirium. All right, so that is delirium tremens. तो इसमें पूछते हमेशा what will you give, and this is your drug of choice, benzodiazepines. But which benzodiazepines, lot benzodiazepines. Okay, then in alcohol toxicity you have McEwan sign, which is dilatation of pupil, morbid jealousy, Munich beer heart, which is dilated cardiomyopathy, and Mellenby effect is जितना जितना पीते जाओगे उतना उतना ज्यादा high आता है. All right, so when you are not completely out you will have a higher high, something of that sort. Legal limit is 30 mg percent, whereas critical limit is 150 mg percent. Critical limit is when you start to have ataxia and balance loss, so now you are harmful to others, you are not harmful to yourself but to others. Okay, so this is the critical level, in coordination आ जाएगा। 250 के बाद कॉमा, वेरी इंपॉर्टेंट, साइकी फान में से सवाल आएंगे। सो मोस्ट पोटेंट एंटीसाइकोटिक विच इज द टिपिकल एंटीसाइकोटिक इज हैलोपेरिडोल, जिसमें मैक्सिमम आता है आउट ऑफ एटिपिकल इट इज रिस्पेरिडोन विच हैज मैक्सिमम D2 blockade. Minimum is clozapine. So the most potent atypical is clozapine. It's in a different league altogether, but then we can't use it because of many side effects. The most common of the most dreaded of which is agranulocytosis. It will have maximum metabolic side effects. It will have wet pillow, which is sialuria, and you can also have myocarditis. So these are all of the side effects of clozapine. Very, very important. It is used in refractory psychosis where two antipsychotics have been non-successful. Unsuccessful. Then for no weight gain and QT, you want to remember Zara here. Zara was low birth weight, uska weight gain nahi ho raha tha, and she's a QT, है ना? So we will remember Zara and we remember ziprasidone. Okay, I've used my daughter also for mnemonics. My God, ziprasidone. Okay, another thing where you can also have QT prolongation is thioridazone. Okay, so you have thioridazone, which is there, and then you have retinal pigmentation, which is also thio R, which is retinal pigmentation. Okay, vortex keratopathy, Cursec chlorpromazine, and cholestatic jaundice, Cursec chlorpromazine. Cataract is Cursec, which is quetiapine, and PD induced psychosis ka drug of choice, which is new, is P for pimavanserin. Okay, pimavanserin. Okay, so these are your antipsychotics. Extrapyramidal side effects are more common for typical psychotics. So you have adapt. So first, which develops in a matter of hours, is acute dystonia, inability to sit still, अभी जो हो रहा होगा है ना, इधर उधर you're running around, akathisia. Then you have Parkinson's, and then you have uh, tardive dyskinesia, which is late. So this happens in hours to days, this happens in weeks, this happens in months, and this happens in years. 6 months के बाद tardive dyskinesia होता है. The mechanism of tardive dyskinesia is hypersensitivity to the dopamine receptors. Here you will have the drug of choice as VMAT inhibitor, which is valbenazine. Okay, beta blockers is the drug of choice for akathisias. Antidepressants, most common side effect of SSRI is sexual side effects. Okay, in the chronic stages, in the acute stages, it is GI. Drug of choice for severe depression, we have to do SNRIs because they have dual mechanisms. Minimal sexual side effect is with mirtazapine, which is an NSSA. All right, ये थोड़ा अजीब से एक्ट करता है. मिनिमम वेट गेन एंड सिडेशन, एंटी स्मोकिंग, सीजर्स, ये तीनों है ब्यूप्रोपियोन. ब्यूप्रोपियोन इज वेरी वेरी इंपॉर्टेंट. इसको बुस्पाइरॉन से कंफ्यूज नहीं करना. व्हाट इज ब्यूस्पाइरॉन? ब्यूस्पाइरॉन इज एन एंटी एंजाइटी ड्रग. क्या मैकेनिज्म होता है? 5-HT1A blocker, right? So that is buspirone. Okay, bupropion is your NDRI. All right, so norepinephrine dopamine receptor inhibitor. This is minimum weight gain and sedation, very important. Anti-smoking along with varenicillin. Varenicillin is also your anticholinergic blocker, right? So that's your N blocker, N channel ka blocker hai, and it precipitates seizures in bulimic patients. Priapism, remember trazodone. So trazodone is the priapism drug jiska side effect hota hai. This we have already done. Sodium bicarb, and in pregnancy you have to use sertraline, SSRI, which is sertraline, which is the drug of choice. ठीक है. ये एगोनिस्ट है क्या? दिस इज एगोनिस्ट, बिस्पाइरॉन. ओके, ठीक है. मूड स्टेबिलाइजर्स, ठीक है. एंटी एंजाइटी मैंने पढ़ाया नहीं कभी. सो दिस इज बिस्पाइरॉन. ओके, मूड स्टेबिलाइजर्स. सो ड्रग ऑफ चॉइस इन अक्यूट मेनिया, यू हैव टू गिव एटिपिकल एंटीसाइकोटिक्स. ओके, चूज ब्यूप्रोपियोन देन. Okay, atypical antipsychotics in acute because lithium takes time, so you have to add lithium, but you can't give lithium alone. For prophylaxis, lithium alone is sufficient. Mood stabilizer for preventing suicide is again lithium. It is the most potent. Drug of choice for rapid cyclers is valproate. Mood stabilizer in depression, all else. So lamotrigine and lithium are effective in depression. Adverse effects. So the earliest sign of toxicity is tremors. All right. So coarse tremor is the earliest sign of toxicity. You have nephrogenic diabetes insipidus, which can lead to vomiting and diarrhea. Then you can have thyroid, you can have hyperparathyroid abnormalities. All right. Then the values are very, very important. So what is the prophylaxis level of lithium? 0.5 to 0.8. Acute mania, the level is 0.8 to 1.2. Toxicity happens beyond 1.5 and dialysis is indicated more than 4. Okay. T half, what is the T half? It is 24 hours, and that is why it takes time. So the measurement has to be 5 days after it stabilizes in the blood stream. Okay, so this is about lithium. सब कुछ ये देख लो फटाफट. Stream is flight of ideas, pressure, retardation, circumstantiality, and prolixity. This is what it all boils down to. So content is delusion, and obsession is a possession disorder. It is not a content disorder, right? So a possession disorder is thought insertion, कि कोई डाल रहा है, thought withdrawal, कि कोई thoughts लेके जा रहा है, या कोई मेरे thoughts broadcast कर रहा है. So those are all possession disorders with obsession, impulse, and phobia. And form, ये पूछा गया है, derailment is a type of formal thought disorder. So these are all. Schizophrenia is a formal thought disorder. So loosening of association, tangentiality, new words, which is jargon है ना, neologism, and incoherence, कुछ भी words बोल रहे हैं. Okay, so OCD is this, no, possession. Obsession is possession. ठीक है. Quickly going on to anesthesia, most of the instruments we've all done. So just the capnography. So this is what a normal capnography looks like, where the 45 level should come. When you see that it is having this shark fin appearance, this is COPD or bronchospasm. When you see that rate has become slow and CO2 is increasing, this is hypoventilation. When you see rate is very high compared to normal and the CO2 is decreasing, this is hyperventilation. When you see that the baseline is increasing and then CO2 is increasing, you need to change the soda lime. It is a reabsorption, rebreathing circuit which is happening. When you see that these breathing clefts are forming, spontaneous breaths are in curare clefts, you need to give a blocker, a top up. Okay. Sudden loss of waveform, very very important. Yeah, तो most important you want to rule out is air embolism. सीधा ही take the patient into Durant's position. What is the Durant's position? Left lateral decubitus and Tredelenburg, है ना? तो head down कर दो और left lateral कर दो, so that air will come up into the right atrium and you can suck it out through the central venous catheter. Okay, so that is first. Apart from that, you can have cardiac arrest, and सबसे फालतू जो हो सकता है कि आपका सर्किट ही डिस्कनेक्ट हो गया, है ना? तो ये तो पहले ही रूल आउट कर लो, ठीक है, बिफोर यू डू एयर एम्बोलिज्म का मैनेजमेंट. डिक्रीजिंग EtCO2 हो रहा है मींस इट इज इसोफेजियल इंट्यूबेशन. CPR assessment के लिए two things, you know, return of spontaneous circulation is defined as any time it comes back to 45, 40, yeah, when it anytime it's more than 40. And for good adequate chest compression it should be more than 20, more than 20 पे आ जाना चाहिए. That is more important. Sudden increase in EtCO2 is very very important. This is the earliest sign of malignant hyperthermia. Hyperthermia per se is very rare. Okay, so succinylcholine, halothane, इन सब से हो जाता है. Drug of choice is dantrolene sodium. ड्रग ऑफ चॉइस फॉर प्री ऑपरेटिव एंजाइटी इज मिडाजोलाम टू रिड्यूस द सिक्रीशन. ये पूछते हैं ग्लाइकोपाइरोलेट. एंटीबायोटिक कब देना है? 1 hour बिफोर इंसिजन. द नर्व इंजर्ड इज अल्नार नर्व, लाइक वी हैव ऑलरेडी सेड. मोस्ट कॉमन ऑप्थेल्मिक कॉम्प्लिकेशन इज, what is the most common yeah, it is due to pressure in prone position, corneal abrasion. Drug of choice for post-operative nausea and vomiting is ondansetron. So chemotherapy, yeah, post-op, it is always ondansetron. Then post-operative vision loss ka most common is ischemic optic neuropathy, AION, anterior ischemic optic neuropathy. And most common cause of intra anaphylaxis, earlier it was antibiotics. No, yeah, earlier it was muscle relaxants. Now they say it is antibiotics, which is the more common cause. Okay. ये फटाफट फटाफट कर लेते हैं. सो एनी टाइम यू हैव BLS, बेसिकली फर्स्ट स्टेप इज ऑलवेज वेरीफाई सीन सेफ्टी, चेक फॉर रिस्पॉन्सिवनेस, शाउट फॉर हेल्प. तो ये सारी चीजें बहुत इंपॉर्टेंट है. सीन सेफ्टी, रिस्पॉन्सिवनेस एंड शाउट, वेरी गुड. SRS, ठीक है. तो ये करना है. कॉल फॉर AED, किसी को बोलो कि यार AED लेके आओ, एम्बुलेंस को बुलाओ. एंड देन व्हाट यू हैव टू सी, फर्स्ट यू हैव टू सी वेदर पल्स इज देयर एंड यू हैव टू सी वेदर ब्रेथ इज देयर. अगर दोनों ही नहीं है देन यू स्टार्ट CPR. So what is the pulse that you will check? What is the pulse that you check here? It is carotid, right? So carotid pulse is to be checked in an adult, whereas if it's a child you can check carotid or femoral, whereas in an infant you check the brachial pulse. Okay, then how do you start CPR? So it's 30 chest compressions followed by 2 breaths. So this is CAB, पहले chest and फिर airway breathing. So first you do this, है ना. Checking में तो कैसे भी check कर लो, that's is that given. Look for no breathing and pulse, that's simultaneously, है ना. देखो तुम्हारे जैसों के लिए लिखा भी बेचारों ने कि simultaneously. So पृथ्वी है क्या ये? Prithvi, why are you attending? So this is CPR. So we have to do 30:2. All right. So we have to do chest compression and we have to give 2 breaths. Okay. So chest compression and 2 breaths is what we have to. Prithvi, you will get galis from others because you are increasing competition for no reason. है ना? सब गाली देंगे if it is you only. So this is chest compression and then you have to give 2 breaths. Fine. So what is the ratio? 30:2. Okay, so 30:2 breaths देना है आपको. हाँ, see it is you only. अभी now you will get galis from everybody. So 30:2 ratio आपको देना है adult में. What about child? Ratio सब में ही same है, but child में ये हो जाता है कि you can do 15:2 if you have 2 helpers. 2 लोग हैं तो you will tire, है ना. तो you have to do 15:2. Okay, now no chit chat. Come on, come back. So much to do. फिर रह जाएगा, फिर you will be like ma'am extra class, which I will not be able to do. So rate. What is the rate of chest compression? So press hard, press fast. Press hard is what? 100 to 120 per minute. है ना? So this is press fast. Press hard meaning what is the depth of compression? So the depth of compression here is gonna be 5 to 6 centimeters in an adult or 1/3 of the AP chest. In a child, it is 5 centimeter. In an infant, oh god, my 5, it is 5, and then in an infant it is 4 centimeters. Okay, so this is about the depth. So press hard and press fast, very important. So press hard meaning itna compress karo and then wait for recoil, that is also a criteria. Okay, wait for chest recoil. Press fast meaning 100 to 120 per minute should be your rate. Okay, how many hands? So you use 2 hands as a interlock karke. In a child you can use 1 hand and in an infant you use thumb. Okay, fine. Why are you guys silent? Okay, breaths. How many breaths do you give? So in an adult, the breath rate is 10 breaths per minute. Okay, so this is 10 breaths per minute. When it becomes a child, उसको डबल कर दो, 20 to 30 breaths, एंड व्हेन इट इज एन इन्फेंट इट इज 40 to 60 breaths पर मिनट, डबल करते जाओ. सो लुक एट एन इन्फेंट एंड अ नियोनेट, ऑलराइट. सो नियो, इन्फेंट नहीं, ये नियोनेट है. सो नियोनेट 40 to 60. सो व्हाट इज अल्टीमेटली द रेट? यहाँ पे आप 30:2 कर रहे हो, नियोनेट में रेट बिकम्स 3:2, राइट? इट बिकम्स 3:1 एक्चुअली. All right, so 3 chest compression and 1 breath because the breath is very fast. है ना? So this is how in neonatal respiratory program this is different. Okay, I hope you guys understood that. So 30:2 पे देते रहो. Once AED comes, then it will do its own job. It will give. So this is what AED looks like. It will give the shock on its own. On the other hand, if this is ACLS, in hospital you are witnessing a cardiac arrest. Start oxygen, attach the monitors, and then after attaching the defibrillator, now we are assessing the rhythm. So what is this? This is VFib. This is VTAC. These are both shockable rhythms. On the other hand, when you have no pulse, but this is what? This is pulseless electrical activity, and this is asystole. These are non-shockable rhythm. So if it is a shockable rhythm, immediately give shock and start CPR. Don't wait. Start CPR. CPR करते shockable rhythm देखो. If it is shockable, again give shock, and now you will give epinephrine. 2 बार shock देने के बाद we give epinephrine, first line drug. How much epinephrine? 1:1000. 1:1000? No. 1:10,000, ma'am. Never give 1:1000 in IV. So 1:10,000 in IV circulation. If this is not possible, intraosseous. Okay. Every 3 to 5 minutes. Apart from that, drug of choice for VTAC we know is amiodarone. So give amiodarone 300 mg and then 150 and then give lignocaine. On the other hand, if it is asystole, you can't give shock. Can you give amiodarone? No. Can you give lignocaine? No. So the only thing you're gonna go do here is epinephrine. Okay, so this takes care of ACLS for us. Adrenaline dose very quickly. So anaphylactic shock or status asthmaticus is 1:1000, and this is where you can give IM or subcutaneous. Cardiac arrest 1:10K IV or IO. Vasoconstriction is 1 in 1 lakh. This with LA is 2 lakh, and for labor epidural it is 1 in 4 lakh. Wonderful. Okay, going on to anatomy. Very quickly, we have the dermatomes and the myotomes that you need to remember here. So, सबसे पहले L2 वाली series कर लेते हैं. Alright, so let's do the L2, L3, L4, L5 series here because that is very important as far as myotomes are also concerned. So, ये पूरा dermatome का list है. I'm first teaching you myotomes, okay, which is the muscular function. So, L2 पे what you're gonna do is you remember hip flex. Once you remember hip flex, then you keep inverting the function. Okay, तो L2 hip flex खाली याद रखना है. So hip के नीचे क्या जाता है? knee. तो उल्टा कर दो, opposite कर दो, it becomes knee extension. knee के नीचे आता है ankle. ankle को flex कर दो. कैसा flexion? dorsiflexion. Okay, then you have to do extensor hallucis longus because it was flexor, and then you do flexor hallucis longus. So this is your motor function. As far as the dermatomes are concerned, because L2 is around the hip, that is going to be your upper thigh ka dermatome. L3 is around the knee, so that is going to be medial femoral condyle around the knee, basically lower thigh. This is going to be the leg, but L4 is what leg? Remember, the most important leg is medial. Medial is where you go down and then you come up through the lateral part. So medial leg is L4. L5 is very important. This is going to be the web space. First web space is L5, and S1 is S for sole and little finger. ठीक है, जितना मैंने लिखा है उतना ही याद रखना है. ठीक है, so this is gonna be your L2 to S1. When we come up, S2 is gonna be S2 is going to be this part here. So can you see here how as you keep going, as you keep increasing the number, you keep going inside. So S2 is this area, and then S3, S4, S5 is more in perianal. All right. So you keep going inside as the number increases. So S5 basically is your anal sphincters and your bulbocavernosus reflex, right? So that is your S3 to S5 reflexes. Reflexes pata hai na sabko. So L2 is your cremasteric reflex ka root. Why did I do that? L2 is cremasteric reflex ka root. L3, L4 is your patellar reflex. S1 is your ankle reflex. Okay, and S2, S3 is your anal and bulbocavernosus reflex. Spinal shock में the earliest sign of recovery is what? अब थोड़ा ज्यादा फास्ट हो रहा है ना, but then there's so much to do. Yeah, it is bulbocavernosus. Okay, bulbocavernosus is the fastest. Okay, it's the first to recover. Okay, so this is about the pair. Then when we come to the hand, what you want to remember here is you want to remember the dermatomes. So remember, see C6 and C8. मिडल फिंगर देख के क्या याद आता है? 7, ओनली 7 नंबर कैन बी ड्रॉन हियर, सो C7 इज द डर्माटोम ऑफ मिडल फिंगर. छोटा फिंगर कौन है? व्हेन आई कीप माय हैंड लाइक दिस, थंब सबसे नीचे रह जाता है, राइट? सो C6, द स्मॉलेस्ट फिंगर इज द थंब, एंड C8 इज योर लिटिल फिंगर. नाउ हियर दे आल्सो आस्क यू अबाउट द क्या बोलते हैं, एक्सक्लूसिव डर्माटोम्स ऑफ मीडियन, अल्नर एंड radial. So you draw, you go this. So the tip of little finger is ulnar. The tip of the this finger is median, and this web space is radial. Okay, so this is how radial, median and ulnar. Okay, so index is this. ठीक है? हाँ, काफी करा दिया 6 hours में, more than what I thought. So this is about this. All right, and then also remember, so C6, C7, C8 हो गया. जैसे ही ऊपर आओगे, मीडियल, अगेन मीडियल. सो T1 पे अपन आएंगे मीडियल एंटीक्यूबाइटल, एंड ये पूछते हैं. फिर T2, T4, T6 सुन लो. T4 इज एपेक्स ऑफ एक्सिला. T4 पे आएंगे तो निप्पल्स आ जाएंगी. T6 पे आएंगे तो जिफॉइड. X इज 6 ना, X इज जिफॉइड. एंड T10 तो सबको पता ही है, 10 इज अम्बिलिकस, है ना? तो बस इतने याद कर लो, तो बस जिंदगी सफल. फाइन. आर यू गाइस सॉर्टेड एज फार एज दिस इज कंसर्न? तो इससे पूरा पूरा अपर लिम्ब हो ही गया. ये छोड़ दूं, क्रेनियल नर्व कॉलम्स छोड़ दूं, जॉइंट्स का स्लाइड मैंने स्किप कर दिया. आई विल डू इट इन द यूट्यूब सेशन, एकदम एंड में बता दूंगी, ठीक है? बिकॉज यू विल फॉरगेट अदरवाइज. सेव वर्जन या सेव वाज, आई थिंक यू नो दिस इज आल्सो देयर इन सेरिबेलम यूट्यूब, जो है ना, जो मैंने आपको करने को बोला है. ठीक है, तो ये देख लो जरूर. GVE, तो सारे ग्वेज कौन है? ग्वेज आर योर पैरासिम्पथेटिक ग्लैंड्स, है ना? तो पैरासिम्पथेटिक ग्लैंड्स में कौन आता है? यू हैव 3, 7, 9 एंड 10, है ना? तो 3, 7, 9 एंड 10 में क्या क्या है? सो थर्ड वन इज योर एडिंगर वेस्टफॉल न्यूक्लियस. यहाँ से आपकी क्रेनियल नर्व 3 आएगी, एंड इट विल गो टू द सीलियरी गैंग्लियन. सबके गैंग्लिया पता होना चाहिए. सो विल गो टू द सीलियरी गैंग्लियन, और वहां पे आपका प्यूपिलरी एंड सीलियरी मसल से कंस्ट्रिक्शन हो जाएगा. 7 is gonna come from superior salivatory nucleus, or from superior salivatory nucleus you're going to have the seventh nerve, which is going to have greater petrosal एक part, which will go to PPG, pterygopalatine ganglion, and that will supply lacrimal and palatal glands. इसी में से chorda tympani आएगी, which is going to go into the submandibular ganglion. submandibular ganglion से submandibular glands में जाएगा. ninth cranial nerve किसको supply करने वाली है? glossopharyngeal. This is going to come into the otic ganglion. All right, so from inferior salivatory nucleus it will go into the otic ganglion, and वहां से आपका parotid gland को supply जाएगा. 10th is for your other visceral glands. Okay, so these are the ganglion: ciliary, pterygopalatine, submandibular, otic. I hope this is clear to all of you. Then in nucleus tractus solitarius, NTS, what are the nerves? So you have 9, 10 and 7. नाम से पता चल जाएगा. Nucleus ambiguous is for motor evaluation, and this is dorsal motor, which is 10. So ये वाला ही dorsal motor होता है, ठीक है? dorsal motor nucleus और parasympathetic वाला, ठीक है? तो ये वेगस के nucleuses become important. ठीक है? टंग के बारे में एम्ब्रियोलॉजी से बहुत सवाल आते हैं. ओके, सो यू वांट टू रिमेंबर दैट एंटीरियर 2/3 ऑफ द टंग इज फॉर्म्ड बाय लिंगुअल स्वेलिंग ऑफ फर्स्ट आर्च. इसीलिए इसका नर्व सप्लाई कौन है? यू हैव V3, है ना? सो V3 इज द नर्व, सेंसरी नर्व सप्लाई, मैंडिबुलर नर्व सप्लाई, बट टेस्ट कौन ले जाता है? 7th cranial nerve. स्वाद मीन्स टेस्ट, यस, वो कहां से आ गया? ओके, सो 7 is taste. Okay, posterior 1/3 is arising from the third arch and छोटा सा part from the fourth arch. इसीलिए यहाँ पे you have the supply of 9th and 10th cranial nerves. Okay, so वो दोनों ही taste and ये लेके जाएगा. So you know, right? 7, 9 and 10 is your NTS. Okay, whereas this is your sensory supply. Is this making sense, all of you? Whereas the muscles are going to be occipital myotomes. So this is going to be 12th cranial nerve. So all the muscles of the tongue are supplied by 12th cranial nerve except palatoglossus, right? So palatoglossus 6th arch है, इसलिए उसको pharyngeal plexus आके nerve supply देता है. Okay, so ये sort हो गया ना? Chorda tympani, glossopharyngeal and vagus, lingual, glossopharyngeal and vagus. ठीक है, तो इसमें से एक सवाल आएगा पक्का से. बाकी मैंने वो बता दिए थे. Masticator muscles, that you know ना, muscles of mastication I have taught you in अभी image thon में. Derivatives पे बहुत सवाल आते हैं. So LFTC, LFTC is your ventral mesentery. So anything which is attached to the liver is your ventral mesentery, right? So you have lesser omentum, which includes hepatogastric, hepatoduodenal ligament, falciform, triangle, coronary. So if the word liver comes, it is ventral. Liver is आगे, ventral meso. बाकी कुछ भी, dorsal is greater omentum, gastrosplenic. So जो भी greater curvature से attached है, right? So greater omentum, gastrosplenic, gastro और बेसिकली या गैस्ट्रोफ्रेनिक और योर लीनोरीनल, ये सारा ही डॉर्सल मेजेंट्री है. ठीक है. Umbilical ligament, median umbilical ligament is your urachus or your allantoin. Medial is umbilical arteries. All right. Lateral is what? Epigastric. Yeah, so these are your epigastric, inferior epigastric artery, and umbilical vein gives rise to ligamentum teres hepatis. Which umbilical vein? Only left is left. ठीक है. न्यूरल क्रेस्ट के डेरिवेटिव फटाफट देख लोगे. मोटेल पासिस, या सो मोटेल पासिस है ना, फटाफट देख लो. फाल्सीफॉर्म इज दिस, नो? ओके, ठीक है. ये भी चलो फटाफट करा देती हूँ. मीजोन हमारा पूरा मेडिसिन ही रह जाएगा एक्चुअली. सुपीरियर वजाइकल इज दिस ओनली. अम्बिलिकल आर्टरी का प्रोक्सिमल पार्ट इज दिस. ठीक है. एम्ब्रियोलॉजी एक बार देख लोगे फटाफट. हाँ, विल यू सी एम्ब्रियो, बिकॉज इट्स ओवरऑल वेरी इंपॉर्टेंट है ना. तो एम्ब्रियो का एमकेटी एक बार फटाफट जस्ट सी द पीडीएफ. ओके, ठीक है, कूल. एपिफाइजिस में तो क्या है? ट्रैक्शन एपिफाइजिस इज कोराकोइड प्रोसेस. एटाविस्टिक एपिफाइजिस इज कोराकोइड प्रोसेस. जस्ट रिमेंबर दिस. एंड जो जो बोल्ड में है वो एपिफाइजिस का लिस्ट फटाफट देख लो. ठीक है, फाइन. ब्रेकियल प्लेक्सस, one thing if you want to remember, that division is the one which has no branches, and division is the one which is retroclavicular. This is behind the clavicle. Okay, this is what you want to remember. Joints ekdam end mein karaungi, second third ko, hai na, so that you remember. Then they ask you what is the continuation of every cord. So the lateral cord continues as the musculocutaneous nerve. Okay, so musculocutaneous nerve jab hoega, ha ha ye kar lo, iske baad karai rahi hu. Musculocutaneous nerve supplies what all? It supplies, ye aata hai na, coracobrachialis, brachialis, and your biceps brachii है ना. It supplies cutaneous part, which is the lateral part of the forearm. ठीक है. Then posterior cord continues as what now? So the posterior cord here is gonna continue as which part? Which is the radial nerve, and the medial continues as the ulnar nerve, and दोनों मिलके बनाता है median nerve. So these are the continuations that you want to remember here. ठीक है. अपर ट्रंक का अगर लीजन होगा तो क्या बनेगा? अपर ट्रंक का अगर लीजन है तो यू विल हैव Erb's palsy. लोअर ट्रंक का अगर लीजन है तो यू विल हैव Klumpke's paralysis. All right. So this is what you want to remember. Okay, so Erb's में policeman deformity आता है. Remember the nerve roots C5, C6. So policeman is adducted, extended, and that is what you want to remember. And Klumpke is your claw hand, which is your intrinsic hand. Yeah, so adducted, extended, and pronated. ठीक है, क्योंकि biceps नहीं चल रहा. And which is the muscle which is spared in Erb's? ये सवाल आता है. So the sparing is of coracobrachialis. Coracobrachialis is spared here, okay, in Erb's palsy. ठीक है, तो ये याद रख लो. तो मेनली जो नर्व्स ऑब्स में जाती है वो मस्कुलोक्यूटेनियस एंड एक्सिलरी जाती है, बिकॉज दे आर द मेन C5 C6 वाले. ठीक है. So this is what you want to remember. Cerebellar cortex में याद रखो, the only excitatory cell is granular cell. ठीक है, तो granule is excitatory. ठीक है. Then all of the fibers are exit except input comes from mossy. So mossy brings the input to everything except the olivary fibers where the input comes from climbing. Okay, so these are your two input ascending fibers that you gotta know. And the output, which is the inhibitory output, goes from Purkinje. So Purkinje gives the output. So 4 points मैंने बोले वही याद रखो. क्या 4 points? Purkinje gives the output to the cerebellar nuclei, which are the deep nuclei जो further cerebellum और cortex को देंगे. Then excitatory is granule, and input is mossy and climbing. Climbing gives input from olivary nucleus. ठीक है, इतना क्लियर है सबको? इतना ही याद रखना है. फिर all of the cells are in the molecular layer except Purkinje, which is in Purkinje layer, except G, which is Golgi and granule, which is in granular layer. ठीक है. Okay, fine. Now going on to path. So I think this also you know the translocation. So anything with 8 which is even, that is what? That is Burkitt. And T821 is what? This is AML M2. T11, 14, 18. Margin से ले लिया. So T11 and 18, this becomes what? This is your marginal or your maltoma. T11, 14, 11 को उल्टा कर दो तो बन जाएगा मैंटल, है ना, मैंटल सेल लिम्फोमा. एंड T14, 18, 4 से बन जाएगा फॉलिक्यूलर, विच हैज द बेस्ट प्रोग्नोसिस. ओके, सो जो मार्जिन में है उसको सब नेगेटिव, कोई कुछ नहीं देगा, दैट इज योर मार्जिनल जोन लिम्फोमा. व्हेन इट इज ऑल पॉजिटिव, 5, 23, 20, 200, डिलीशन भी है, स्मच सेल्स भी है, कन्वेंट स्कूल भी है, दिस इज CLL, SLL. When 5 is positive but 23 is negative, this is your mantle, है ना, mantle. Then CD10 positive, BCL2, whenever you're in a pair of 2, it's always a good prognosis, follicular, best prognosis. CD10, BCL6, when everything is starry sky, this is Burkitt. And most aggressive, most common for everything, this is DLBCL. 3 पॉजिटिव है मतलब क्यूटेनियस टी सेल है, बाकी सारे बी सेल है. ब्लीडिंग में जब भी परप्यूरिया या पेटिके मिल रहे हैं, मींस इट्स अ प्रॉब्लम विद द प्लेटलेट्स. सो डू द प्लेटलेट काउंट. इफ प्लेटलेट काउंट इज नॉर्मल, मींस फंक्शन में प्रॉब्लम है. सो इफ दे गिव यू रिस्टोस्टैटिन aggregation is abnormal, this is Bernard Solier, which is GP1B9. But if it is abnormal ADP or collagen aggregation, that is Glanzmann's thrombocythemia, which is 2B3A में problem, aggregation में problem. So don't be confused by this aggregation. This is a misnomer. Okay, when platelet count is reduced but immature count is high, means destruction हो रहा है. So this can be ITP. All right, immune thrombocytopenic purpura, जिसमें 1B9 के against you have antibodies. Okay, yeah, so this is adhesion actually, but the test name is aggregation. ठीक है, इवन दो GP1B9 does adhesion. इमेच्योर प्लेटलेट काउंट ही लो है, मतलब बोन मैरो में ही कुछ नहीं हो रहा, सो दिस इज गोना बी aplastic anemia. Okay, so this is for platelet. But when you have ecchymosis, hemarthrosis, and clotting time is deranged, then you do PT APTT. If PT is ranged, means PT means outside. So this is extrinsic pathway, means factor 7. So this is seen in early warfarin toxicity or early vitamin K deficiency. You will have only factor 7. So warfarin में 2, 7, 9, 10 है, क्योंकि 7 का shortest half life है, that is gonna be early. Okay, thank you so much. APTT is raised, meaning इंट्रिंसिक पाथवे में डेफिशिएंसी है. सो अगर तो चाइल्ड है तो हीमोफीलिया कंसिडर करेंगे. हीमोफीलिया A, B and C. What are the factors? Factor 8, factor 9, factor 11. These two are X-linked recessive, but C is autosomal recessive, तो फीमेल में भी हो सकता है. अडल्ट है तो क्या हो सकता है, याद करो, अगर रिकरेंट प्रेगनेंसी लॉस है, एप्ला हो सकता है, राइट. उसके अलावा इट कुड बी एन इनहेरिटेड, नो, इट कुड बी एन अक्वायर्ड हीमोफीलिया, मीनिंग inhibitors आपके आ रहे हैं, right, recurrent translocation. So you do a mixing study, it will get better. Very nice. When both are normal, meaning बहुत, व्हेन बोथ आर नॉर्मल मीनिंग सब कुछ नीचे में प्रॉब्लम है. सो फैक्टर 13 में प्रॉब्लम है, राइट. फैक्टर 13 इज व्हेन बोथ विल बी नॉर्मल. एंड व्हेन बोथ आर रेज मींस कॉमन इज फैक्टर 10. सो फैक्टर 10 में प्रॉब्लम है, या DIC है, या TTP है, तो मल्टी सिस्टमिक प्रॉब्लम हो गया. ठीक है, सो दिस इज व्हाट यू वांट टू रिमेंबर. फैक्टर 13 इज योर लैकिलोरैंड फैक्टर. वंडरफुल. सो ये भी हो गया. एंटीकोएगुलेंट्स एक्सट्रीमली इंपॉर्टेंट. सो सबसे पहले ना एंटी प्लेटलेट ड्रग्स कर लेते हैं. तो एस्पिरिन इज योर कॉक्स इनहिबिटर. फिर वॉन विलीब्रांड फैक्टर दोनों में आ जाएगा, है ना. तो APTT रेज्ड होगा क्योंकि फैक्टर 8 डेफिशिएंसी हो जाती है ना वॉन विलीब्रांड के साथ, तो ये इसमें भी आ जाएगा. वॉन विलीब्रांड में ये सब भी प्रॉब्लमैटिक होएगा. ठीक है, fine. So P2 Y12 receptor blockers very important. So irreversible is ticlopidin, clopidogrel and pasugrel, and GR जिसमें आ रहा है Grelors are your reversible. ठीक है. Then GP2B ये बहुत पूछते हैं. So abciximab हमारा एंटीबॉडी है जिसमें भी फिब आ रहा है. फिब drugs are your 2B3A because fibrinogen, yeah, English fibrinogen is gonna be blocking. All right. So wherever the word fib comes, it's gonna be GP2B3A blockers. Fine. PDE3 inhibitors are going to be your dipyridamole and cilostazoles. Okay, so these are your antiplatelet drugs. Please remember this list here. Then anticoagulants. So this is where you have factor 2 and factor 10. When factor 2 and 10 both are being blocked equally, that is your unfractionated heparin. When do you use unfractionated heparin? It's the only one heparin which is safe in renal failure. So that is where I use, but I don't use because it it causes heparin induced thrombocytopenia around 5 days after I start heparin. So what is the drug of choice for heparin induced thrombocytopenia? It is going to be direct thrombin inhibitors, which is dabigatran. So the only oral DTI is dabigatran. Okay, thank you so much. Okay, so these are your parenteral DTIs. This is your oral DTI. Factor 10A के नाम में ही, in the name itself, you will have XA. So wherever you see XA, those are the factor 10A inhibitors, and the antagonist is andexanet alpha. Remember this. इसके नाम में भी, in this name also there is XA. So this is the inhibitor or antidote, and antidote for dabigatran is daru. Okay, that we have learnt. Low molecular weight heparin, which is enoxaparin, dalteparin, is also both, but this is 2 more than 10. Okay, and you also have fonda parinox, which is also 2, exclusive 2. Okay, fine. So this is about all of the heparins that we have. Okay, then ये करना है क्या, blood group, ये तो पता ही है. So in blood group, in antigen, what are the antigens that you have? So H antigen everybody has, right? So blood group A has A antigen and H antigen. So antibody is gonna be anti B. Okay, whereas in B you have B antigen, you have H antigen, यहाँ पे A B सारा ही है, so you have no antibody here, right? So that is why this is universal. ये तो इजी है ना. दिस इज यूनिवर्सल रिसिपिएंट. ओ में क्या है? ओ में यू ओनली हैव द एच एंटीजन, सो यू हैव एंटी ए एंड यू हैव एंटी बी हियर. ओके, whereas blood group, Bombay blood group has no antigen, even the H antigen which is the father वो भी नहीं है, so they have all antibodies, so that is why they can only accept from Bombay blood group, है ना, they can only accept from Bombay. Then identifying the, this is all medicine path integrated only, so we have entered the medicine territory. So here identify the blood group. So wherever the clumping is, that is your anti, that is your blood group. Okay, so this becomes A negative because D भी clump नहीं हो रहा. Here you have A clumping and D clumping, so this is A positive. Here you have clumping of B, so this is B negative and this is B positive. Okay, on the other hand, what is this? Wherein D is clumping and H is clumping, A B में nothing is clumping, so O positive. Whereas here, when nothing clumps, H antigen is also not there. This is Bombay blood group. What is the antigen which confers resistance to P Vivax and P novel C? This is the Duffy antigen. Okay, McLeod syndrome, you have something called as the Kell antigen, है ना, Kell antigen. And what is the antigen absorbed from the plasma? इनको क्या नाम देते हैं? The antigens which are absorbed from plasma, this is the Lewis antigen. Okay, so ये तीन named antigens है which you want to remember. As far as blood storage is concerned, you want to remember their half lives. Okay, so CPD, citrate phosphate dextrose, citrate is going to sequester the calcium. This is 3 weeks. CPDA, when you add adenine, it becomes 4 weeks, and SAGM is 5 weeks. Okay, so this is 3, 4, and 5. Massive transfusion, you will have hypocalcemia. How do you define as massive transfusion? 10 units over 24 hours. So more than 10 units in 24 hours is massive transfusion. You have hypocalcemia because there is sequestering. Potassium can be high or low. Acid base, early on it will be metabolic acidosis because of citrate, but then it becomes alkalosis because citrate becomes bicarb. Okay, so this is very important, and most common cause of death is dilutional coagulopathy. Here, the storage temperature of whole blood is going to be 2 to 6 degrees Celsius. It can be stored for 3 to 5 weeks depending on what you have done. Platelets, you got to store at room temperature, right? So this is 20 to 24 degrees Celsius. That is why there is very high risk of temperature. And the half-life here is only 1 day without agitation. But if you are agitating, then it is 5 days. FFP and cryo, you have to store at freezing temperature of minus 30 degrees Celsius, and they can be stored for up to 1 year. Transfuse blood and PRBC within 4 hours, and these two transfuse within 30 minutes. PRBC will increase the hematocrit by 3% or the hemoglobin by 1 gram DL. Platelets will increase by 5K in 1 unit, and FFP cryo you will have a 2% increase in the coagulation factor. Cryo में क्या क्या होता है? Cryo में Von Willebrand है. Yes, we will do that. So we have Von Willebrand factor. Von Willebrand के साथ we have factor 8, and when you add 8 and V, which is 13, this is factor 13. So these are the three components and fibrinogen which is there in cryoprecipitate. Okay.
Yeah, 10K in platelet, is it 10? That is what I taught last time, is 5K, but yeah, it could be 10K also. 5 to 10, dekh lo, just confirm that, not important. Then reactions are very, very important. So febrile sagam is 6 weeks. Yeah, 3, 5, and 6. Sorry, this is not 4, this is 3, 5, and 6. Okay, so CPDA is 5 weeks and this is 6 weeks. Okay, 3, 5, and 6. Most important is transfusion reaction. So overall the most common is fever, febrile transfusion reactions. What do? You just have to give supportive, do not stop the transfusion. How can you reduce the risk? You can reduce the risk by using this leukoreduction filter. Very, very important. They reduce the febrile reaction risk and they reduce the risk of CMV infection. Okay, hemolysis ho gaya. If you have not done ABO matching, this is the worst type of reaction. You gotta stop. History diya hoga hemolysis ka, flank pain ka. Stop transfusion. Allergic reaction, just antihistaminics. Trali, again stop. It is because of HLA, donor HLA के against antibodies से होता है. Very, very important. ARDS within 6 hours. Stop. Whereas if it is circulatory overload, just go slow. You will have dyspnea in both cases, but here JVP will be raised. Okay, that is how you can distinguish. Okay, so these are the reactions. Can you see this? Immune. What all do we have? Let me give you options. So what all we have is immunodeficiency, which is left. We have, what can we do which is the highest yield? There's so much stuff which is left from let me teach you pharma. फार्मा कर लेते हैं फटाफट. इन 7 minutes आई कैन जस्ट डू फार्मा. बाकी सारा आप इंटीग्रेटेड से देख सकते हो, या इन यूट्यूब वी कैन कंटिन्यू. आई मीन आई डू द रिमेनिंग टॉपिक्स फॉर श्योर. या या सो लेट मी जस्ट डू दैट. यूट्यूब में ही कर ले. आई थिंक टू मच हो गया आज का. हाउ मेनी स्लाइड्स डू वी हैव? पूरा तो यूट्यूब पे नहीं कर पाएंगे. या आई डू एज मच एज पॉसिबल. ठीक है. सो इम्यून में कर लो. राइट, सो इम्यून वाला तो यू कैन जस्ट रिवाइज. लेट्स डू इम्यूनो डेफिशिएंसी वेरी क्विकली. व्हाट इज दिस? Cute baby. So this is Viscott Aldrich. Yeah, so this is Viscute Aldrich or Viscott Aldrich, where you have this baby wearing a tie. Okay, so Viscott Aldrich में tie पहना हुआ baby. So you have thrombocytopenia, infection, and eczema with IG. Whenever IG is there, you will have eczema. So this is Viscott Aldrich. What is this? This is fate. So fate किसका होता है? You will do a job. So this is job syndrome. Job syndrome is also called as hyper IG. So again, hyper IG. So you will have eczema, teeth retained होंगे, you will have abscesses, cold abscesses, and abnormal phases. And this is basically stat job चाहिए at the age of 17. So this is TH 17. This is leukocyte addition, very, very important, which is integrin anywhere one comes. So CD18, LFA1, MAC1, this is LAD1, and the buzzword is gonna be delayed separation, not bleeding. Delayed separation of cord, and there's gonna be no pus. Neutrophilia hoga, but no pus. LAD2 is going to be silyl Lewis deficiency, where you have fucosyl transferase, and association is Bombay blood group, and this is LAD3. This is your Chidiac Higashi, wherein you have LMNOP, so light hoga, albinism hoga, lymphohistiocytis, and there is microtubule mein damage, list mein damage. So microtubule, neurodegeneration, phagolysosome nahi fuse honge, and the hallmark is gonna be these dense granules. Okay, so that is Chidiac Higashi. This, what is this? This is your CJD, chronic granulomatous disease, where you have NADPH oxidase not forming, so catalase positive organism से infection होएगा. NBT was the older test. Now we do the dihydramine rhodamine. So this is NBT. Wherever blue is there, that is normal. DHR is the investigation of choice, which is a flow cytometry investigation. Okay. Then we have your B cell immunodeficiency. So this is Bruton's tyrosine, Bruton's A gamma globulinemia. Because it is A gamma globulinemia, maternal transmission hoga. So buzzword is after 6 months. So you'll have no germinal center tonsil, but 6 months ke baad infection hoga. And B for boys, because this is X-linked. If it is presenting by adolescent, so this is CVID, common variable immunodeficiency. So you'll have hyperplastic germinal centers, and this is selective IgA deficiency, wherein you have giardia and anaphylaxis. Okay, if you have recurrent infection since birth, then it is SCID. Okay, ADA deficiency or your FC chain mein problem. ऐसा phases मिल गया, hypocalcemia, so this is catch 22, this is digeorge जहाँ पे 22q पे micro deletion है. Okay, so this is digeorge syndrome. Catch 22, conotruncal abnormality or cardiac abnormality, abnormal phases, T cell problem, hypocalcemia, and C for हो गया ना, cleft lip, yeah, cleft lip, cleft palate. Vacutaneous तो we will do in the last BTR, so remaining things I think we can do in the last BTR. एक चीज बता देती हूँ खाली, नहीं बस स्टॉप करते हैं, बाकी सारी चीजें वी विल डू. ओके, सो जस्ट गो थ्रू द पीडीएफ एंड डू द इंटीग्रेटेड सेशंस, है ना, इंटीग्रेटेड वाले पीडीएफ फटाफट रिवाइज कर लो, सो मेडिसिन विल बी सॉर्टेड. आई थिंक दैट्स व्हाट आई हैव आल्सो डन. Okay, so now what we have is you have exactly 1 week which is remaining, you have 7 days which is remaining. Please, make it count. Do not do any new resource. All you gotta do, thank you so much, but first just listen to me for 5 minutes. Okay, so 7 days, all you gotta do is revise what you have done so far. Have faith in your own abilities. Is time pe you have to push hard and do facts. Okay, you have to memorize stuff that needs to be memorizing, because in the actual exam on Sunday you will find that out of the 200 questions there will be 100 questions which are based on the concepts, which is your application and long term memory. So 50% questions will not be a direct vomit, it will be something wherein whatever you have learned in your life as a doctor you will have to apply. You will only be able to apply if you are calm, if you are well confident in your own abilities, right? So for that you need to stay calm and confident that I will read questions carefully and I will be able to find the best option. Other 50% are gonna be fact based, which we are all reading right now, which you are all revising right now. So right now focus on this, and for this you trust your instincts. Second important thing is don't make silly mistakes. How do you make silly mistakes? And those of you who are very well read tend to make these silly mistakes because when you read something, when you look at the first sight and you find something you have read, you would have a tendency to jump to that answer. Don't do that. Read four options. You have worked so hard. Do not let overconfidence or complacency take it all to waste. Okay, so you have to read all four options. Promise me you will read all four options and you will eliminate this cannot be correct, this cannot be correct. Out of these two, which is a better answer? That is the approach 200 times over you have to do. ये दो नहीं हो सकता, इन दो में से बेटर कौन है? हाउ डू आई टेक अ बेटर गेस? ओके, सो दैट इज व्हाट यू हैव टू डू. फिर से मैंने सी मार्क कर दिया. सो या, आई हैव अ साइकेट्रिक डिसऑर्डर व्हिच यू नो. Okay, so this is something that you have to do. No silly mistakes and do well. All right, and I am sure you're all gonna do well. If And this is not the end of life, right? This is not the end of life. This is something that is just one exam. Take it as an exam. Do this last 1 week well. Okay, Zara I think is sleeping. I would have gotten her, but she's things are very quiet right now, so I believe she's sleeping. Let me just check. Huh. Anyways, I think she's sleeping. My camera is also off, so I'll just check if she's up. I'll just get her. But thank you so much. And this is the end of the 6 months that we've studied together. Literally, we've studied together. And thank you so much for all the love that you have given me. I do cherish it like to my heart. So thank you so much. And yeah, this is it for An Academy, I guess. Okay, so I see you all on Cerebellum then. And hopefully I don't have to see you. I don't have to see you, but I'll see you for the last final BTRs on Cerebellum. है ना? So that's the end. And Ashirwad class, I will see if An Academy allows, I'll take here only just as a final goodbye. But otherwise on YouTube, I will take for sure. Okay, so just be confident, just do well, and anything that you need in life, you know where to go, right? That is me. Okay, so all the best, and bye. Thank you so much, guys. Bye bye. I think Zara is asleep, so I'll just end the class and I will share a picture of her with you. Okay, all right, guys, thank you so much and bye.